Public health is a key area in human endeavor, and the School of Public Health, on the last count, has for the industry.
The reason for setting up the School of Public Health was to establish a training program that will give opportunity for interdisciplinary research and interdisciplinary collaboration that results in the teaching and of course
Good morning, all, and welcome to day 13 of the first scientific conference of the University of Port Harcourt School of Public Health. Today is dedicated to postgraduate nursing education. And so we are about to start, and we're going to start with the national item and the University of Port Harcourt item. National item, please, let's start, please. The University of Port Harcourt item, please. Thank you very much. But before we start, we'll observe a minute silence for our departed colleague, Dr. Josephine Bogbo, who was the pioneer head of department, pioneer head of the nursing department of the University of Port Harcourt, Let's observe a minute silence, please. May her gentle soul rest in perfect peace. Amen. So we can resume our seats. Let's before we continue, let me read out the agenda for the chapter this event. Then after that, we'll take the messages from the coordinator of the nursing program of SPUTO, SPUTO, that is African Center of Excellence for Public Health and Toxicological Research, Professor Faith Diogo, and then other goodwill messages, including that from the Professional Association of Public Health Nurses of Nigeria. Yes, of Nigeria. Then after that, we will formally award the School of Public Health special recognition award to Professor Faith Diogo for her contribution to project Bamidele Edet, registered nurse, registered midwife, BSc nursing, MPH, PhD, fellow of the West African College of Nursing, professor of public health nursing, and an ordained minister of the Presbyterian Church of Nigeria. The keynote speaker, Dr. Stanley Njaka of the Department of Nursing Science, Ebonyi State University, an early career academic, but hugely respected within and outside the nursing profession. The Deputy Vice Chancellors of our university, Professor Chukwudi Onyaso, the Vice Chancellor, the DVC Administration, Professor Rosemary Ogu, DVC Academic, Professor Angela Frank Briggs, DVC Research and Development. Members of the University of Port Harcourt Governing Council, I want to recognize the presence of Professor Kelechi Okonta, Professor of Cardiothoracic Surgery, and Professor Olufemi Martins Adesope, the multi-talented Professor of Agric Extension and Development. The registrar of our university, Dr. Mrs. Gloria Chinda, and other principal officers of the university, the acting provost of the College of Health Sciences, Professor Ngozi Ekeke, the dean of the School of Graduate Studies of our university, Professor Kinikanwo Aniele, deans of faculties. I want to specially recognize our own dean, Professor the Dean of Dentistry, and Professor Father Walter Hejrika, the Dean of Faculty of Media and Communication Studies. Directors of institutes and centers. I want to especially recognize the center director of the center leader of the African Center of Excellence for Public Health and Toxicological Research, also known as ESPUTO, Professor DST Ogaji, and Professor Faith Diogo, Professor of Midwifery and coordinator special recognition award for her role in postgraduate nursing education in Nigeria. The panel discussants on the team, Dr. Blessing Tochukwu Onyije, Dr. Deborah Onisele, Dr. Tabitha Leslie, Mrs. Blessing Chim Onyemachi Osigbe, Mr. Carlo Obasi, Nurse Vera Nsigbe, all very distinguished nurses and midwives. Distinguished guests, I want to especially recognize the chairperson, executive, and members of the National Association of Nigerian Nurses and Azonwo, the coordinator of the public coordinator of academic programs is Buto, Dr. Dr. Antoinette Ezejiofo, Professor Catherine Ikewechi, and Professor Charles Tobin West, the Deputy Director of the School of Public Health, who also doubles as the coordinator of the Public Health Program in Esputo, and of course, a former CMD of a former acting CMD of our teaching hospital. That's the University of Port Harcourt Teaching Hospital. I want to also recognize the past and present lecturers in the Department of Nursing Science of our university, late Dr. Josephine Bobo, the pioneer coordinator of the program, and was a lecturer in the postgraduate program of the postgraduate nursing program for her sudden death earlier this month. I want to also recognize Professor Josephine Itowa, a professor of nursing at the University of Ottawa School of Nursing, with strong collaboration with the postgraduate program at Esputo. I want to recognize Professor Shea Babatunde, a former director of the University of Port Harcourt Center for Health and Development, that played an active part in the commencement of the postgraduate nursing program of Esputo. Management and staff of the University of Port Harcourt, management and staff of Esputo, and of course the University of Port Harcourt School of Public Health, colleagues and students of Esputo, and ladies and gentlemen. So I have established the protocol. So having established the protocol, I want to quickly go to the opening, the welcome address. I'm sure that Professor Faith Diogo also has something similar to a welcome address. Perhaps she'll give her own immediately after mine. So let me read the opening, the welcome address, which is for this day 13 of the day dedicated to postgraduate nursing program at the first scientific conference of the University of Port Harcourt School of Public Health. Today is Tuesday, 30th September 2025. So it gives me great pleasure to welcome you all to the day 13 of the first annual scientific conference of the School of Public Health, University of Port Harcourt, the day dedicated to postgraduate nursing program in Nigeria. Nursing and midwifery education in Nigeria were mostly professional and carried out in schools and later colleges of nursing and midwifery, and consists of basic nursing and midwifery programs and post-basic nursing in specialized areas of nursing. The Nursing and Midwifery Council recognizes the following subspecialties: mental health nursing, public health nursing, nurse midwife, public health educators, nurse administration, orthopedic nursing, anesthetic nursing, preoperative nursing, ophthalmic nursing, accident and emergency nursing, pediatric nursing, cardiothoracic nursing, bones and plastic nursing, occupational health nursing, ENT nursing, and intensive care nursing. These I actually got from their websites. In addition to these, new subspecialties such as geriatric nursing are emerging due to the changing disease pattern and increasing aging population in need of care and hospice services. Students in the school and colleges of nursing that currently number about 400 in Nigeria are taught by educators, nurse educators, nurse educators registered by the Nursing and Midwifery Council and have the additional qualification of a PGD in nursing, in nurse education, apart from their other certificates. The introduction, however, the introduction of undergraduate programs in Nigerian universities heralded academic training in nursing science. This largely dispensed with the services of the nurse educators and created a huge need for nursing and for nurses with postgraduate degrees in each of the recognized and even in the emerging subspecialties of nursing to teach the students. So with these subspecialties, it is assumed that a typical department of nursing will have at least one lecturer specialist in each of these subspecialties, just as is the case in the medical school. So at present, there is a drastic shortage of nurses with the requisite postgraduate qualifications in all the subspecialties of nursing to teach in the 65 universities that are currently accredited by the Nursing and Midwifery Council to run undergraduate nursing programs in Nigeria. The reasons for this drastic shortage of nurses with postgraduate education include the decision of the Nursing and Midwifery Council to move from professional nursing training in the schools of nursing to a hybrid academic professional training in undergraduate education that created this huge demand. The very few postgraduate programs in the subspecialties of nursing in Nigerian universities also in Nigerian university forced several nurses who desired postgraduate education into non-nursing academic programs, especially in the Faculty of Science. Faculty of Education. So we have a lot. So before now, we have a lot of nurses with postgraduate degrees, but these postgraduate degrees are not often in nursing science because there weren't enough postgraduate programs. And the available postgraduate programs then, the available ones were mostly full-time with completely on-site academic activities. So this seriously affected their subscriptions, as most of the eligible students were married with young children and are in full-time employment. The introduction of virtual real-time lectures and other academic activities by ACE-Puto using the flipped classroom model was a game changer, as it made it possible for students residing and working outside Port Harcourt to enroll into postgraduate nursing programs. Hundreds of students have so far been trained in the past few years, significantly higher than the output of the other postgraduate programs in Nigeria. But ACE-Puto can do better. I believe ACE-Puto can do better by mounting postgraduate programs in all the recognized subspecialties of nursing to serve the needs of the 65 accredited undergraduate nursing programs in Nigeria. A huge need. Remember, each department will need specialists in all these source specialties to effectively teach their students. So these new programs can be mounted still within the ACE-Puto ecosystem, but also can be mounted in an academic center that is solely dedicated to postgraduate nursing education. The lecturers and other resources to mount these postgraduate programs won't be a problem because academic centers in the University of Port Harcourt are given the powers to set and collect fees and then use the collected fees to run their academic programs for subjects to the rules and regulations of the university. So I believe that it won't be a problem for SPH-UNIPORT and then for SPH-UNIPORT to actually mount programs in all these subspecialties to serve the need of our universities. These are our universities. The Nursing and Midwifery Council listed at least 15 of such, and I believe that SPH-UNIPORT and, if possible, a new academic center can actually mount programs in these subspecialties. So, okay. The likely problems pose. Okay, we want to also look at, it is also important to look at the likely problems posed by the employment of lecturers in the nursing department of universities solely in the universities with no formal appointments in teaching hospitals. This needs to be looked into because in the medical school, lecturers are appointed lecturers in the university and then consultants in the teaching hospital. So I believe that should be considered. It is my opinion that this sequestration of nursing lecturers in the university affects the ability, affects the teaching of clinical aspects of nursing science to students. And it also affects the ability of the lecturers to carry out translational research because they may not be in tune with the changing needs of patients that should influence their research studies. Also the need for lecturers in universities, after the need of lecturers in universities has been filled, the professional roles of postgraduate nurses will have to be considered. Will they be considered as specialists, registered as a new cadre of nurses and midwives by the Nursing and Midwifery Council, and then given roles as specialists in hospitals beyond the holders of basic nursing qualification? I think we'll need to consider that. We need to, these postgraduate nursing holders of postgraduate degrees in nursing, will they decide to practice as nurse practitioners, running private maternities and nursing homes and providing occupational health service? Would they decide to do that? Also, will they take up the role of community health nurses, providing horizontal public health services and taking care of the whole community? What my mentor, Professor Suzu, will want to call community matrons. I am sure that the experts lined up for today's event will provide further insights on how to train more postgraduate nurses for improved service delivery and to serve the needs of the increasing number of undergraduate nursing programs in Nigeria. The chairperson of the day, the keynote speaker, and panel discussants were chosen because of their unique qualification and experience. The chairperson of the day, Professor Laide Bamidele Edet, Professor of Public/Community Health Nursing and an ordained minister of the Presbyterian Church, ordained to preach the word of God, administer the two sacraments of baptism and the supper, and also to provide spiritual leadership. Professor Edet is a leading academic in postgraduate nursing education in Nigeria and a strong advocate of evidence-based nursing, as highlighted in her 2024 inaugural lecture titled Bridging the River, Navigating the Currents of Public Community Health Nursing on the Ties of Scholarliness. While the keynote speaker, Dr. Stanley Njaka of the Department of Nursing Science, Ebonyi State University, though an early career academic, but hugely respected within and outside the nursing profession. The panel discussants are also very distinguished. Dr. Blessing Tochukwu Onyije, Dr. Deborah Onesele, Dr. Tabitha Lisley, Mrs. Blessing Oyemachi Osigbe, Mr. Carlo Obasi, and Nurse Vera Nsigbe. I have no doubt that they will do justice to the choosing team of day 13 of this conference. Please sit back and listen to these experts. Welcome, welcome, and thank you. So that was my welcome speech. I think we can now go on and take the speech, the opening remarks of the chairperson of the day, Professor Olade Bamidele Edet. Hello, ma. Hello, Professor Edet.
Okay. Thank you for muting me.
Yes, ma. Can you go ahead and give your opening remark?
Okay. Thank you very much for that. I'm aware that I will not be able to share my screen. So I'll
do you want to do that because they can enable you?
Okay, if they can enable me, that would be nice. Okay.
Okay, you can now share your slides.
Okay, thank you. Okay, can you see my slides now, please?
Yes, ma'am, we can. We can see the slides.
Oh, okay.
Can you put it on slideshow? Can you put it on slideshow, ma?
Can you put it on slideshow? Yeah.
Okay, let me see if I can do that.
Okay, I think it's now on slideshow.
Yeah.
Okay. Please, you will permit me, Professor Best Odinio,
Okay,
the Director, University of Port Harcourt School of Public Health, Professor Faith Diogu, Coordinator of the Nursing Program of Aseputo, University of Port Harcourt, the Rivers Chairperson, National Association of Nigerian Nurses and Midwives, Rivers Chairperson, Professional Association of Public Health Nurses. You will kindly permit me to stand on the already very long established protocols so that I don't make many mistakes. Esteemed conference day attendees of today, distinguished colleagues, members of the press, ladies and gentlemen, I salute the Vice Chancellor, the university and his team, and the University Council, members of staff, and all that have worked very hard to put this event together for the benefit of the conference attendees. I pay special tribute to all the staff and students of ASEPUTO. I congratulate the members of the planning committee who in their discretion decided to invite me to chair the Public Health Nursing Day. I congratulate all the conference attendees for their commitment to lifelong scholarship of learning. So, distinguished colleagues, esteemed guests, and dedicated nurses, it's my honor to be part of this year's Public Health Nursing Day with the theme Advancing Mental Health for Sustainable Public Health in Nigeria, Evidence, Policy, and Community Action. This theme reflects a crossroad of urgent and opportunity for nursing and the nation. Based on the program that I have seen, this Public Health Nursing Day will be exploring the meaning and implications of progressing mental health for sustainable public health in Nigeria on the fulcrum of evidence, policy, and community action. We will advance thoughts on how the key concept in this topic, that's the mental health, the sustainable public health, evidence, policy, and community action, how they can intercept to shape the future of nursing and nursing education in Nigeria. Suggesting a framework for the day, the socio-ecological model provides a robust multi-level foundation for public health nursing by considering the interplay between individual, interpersonal, community, and policy factors that affect mental health. This model is especially relevant for the mental health promotion, prevention, and intervention within Nigeria diverse settings. As we listen to the panel discussion and we also listen to the keynote address, let us use this model to navigate the presentation so that we can see how individuals, communities, groups, and policy factors actually affect mental health. Going back to the global state, nurses and midwives are the backbone of every system. Since 2020, the WHO Director General has called on all countries to invest in nurses and midwives as part of their commitment to health for all. Nurses and midwives are known for helping to make progress towards health for all throughout the world, and now particularly for universal health coverage. It's been said that universal health coverage cannot be achieved without the nurses, because nurses account for nearly 50% of the health workforce. If you look at the number of health workers, 43.5 million, and look at the number of nurses and midwives worldwide, about 20.7, it attests to that. The State of the World Nursing Report 2025 by the World Health Organization gives us a comprehensive analysis of the global nursing workforce, emphasizing the crucial role that nurses play in contributing to the universal health coverage and sustainable development goals. There are some key findings from that report. Although the global nursing workforce has grown from what it used to be in 2018 to now 29.8 million, yet there are still a lot of disparities, in particularly affecting the distribution in low and middle income countries. And this limits a lot access to essential health services, because our postgraduate program, our undergraduate nursing program, postgraduate nursing program, the ultimate is to render high quality nursing care to our populace. So that's our ultimate. So although the shortage globally has reduced marginally from 6.2 million in 2020 to 5.8 million in 2023, there are still a lot of disparities, because most of the nurses are located in countries that in high income countries. So the workforce generally is young overall, about 33% that are under, let me, okay. So while in the high income countries, they are facing the issue of retirement, and which exceeds those who are entering. So shortage is still a lot of problem in nursing. Um, while in Nigeria, we are planning to advanced nursing practice rules, to put in place advanced nursing practice rules, which have already expanded in many other countries, compared to 53% in 2020. So we are hoping that Nigeria will be able to key into that rule, at least in the coming year, because the Nursing and Midwifery Council has actually put in place a lot of what is required in terms of getting legislative backing, and the curriculum for it has also been developed. I think we are now at the stage of getting NUC to buy into it, and then we can now start floating it. So mental health support and well-being for nurses remain insufficient, not only in our country but even globally. Only 42% of countries provide mental health provisions to the nursing workforce, not to now talk about the populace itself. So priority policy for 2026-2030 is going to focus on expanding and distributing nursing jobs, strengthening education system, improving working conditions and pay equity, advancing nursing regulation and leadership, promoting gender equity, protecting nurses in fragile settings, and preparing for I need to do a little adjustment to the so that I'll be able to see, because I cannot see some aspects. Okay, fine. So I'm preparing for digital and climate responsive care. So these pivotal reports of the state of nursing globally underscores the urgent need for investment in nursing education, which Puto is undertaking, the creation of jobs, leadership, and supportive environment, so that we can build a resilient health system worldwide, including Nigeria. The Nigerian situation in respect to our team today highlights the convergence of these global and local challenges. With less than 250 psychiatrists for over 200 million citizens, and 80% of those with severe mental health needs, unable to access adequate care, the burden is immense. Hence, we are focusing on mental health today. Mental health services in Nigeria remain constrained by stigma, negative attitudes, lack of resources, and limited access, especially at the primary healthcare level. With respect to mental health nursing in Nigeria, the nurses are facing profound challenges and opportunities. The World Health Organization has estimated that 1 in 5 Nigerians, almost 40 million people, live with mental health conditions such as depression, anxiety, and substance abuse disorders, which in most cases are not diagnosed and are not being managed. Despite this immense burden, the country has fewer than 300 psychiatrists and only about 1,000 psychiatric nurses nationally, a severe shortage compared to international recommendations. The impact of these shortages is deepened by significant brain drain, as many of our professionals still continue to leave Nigeria on a daily basis for better opportunities. So we need to really think of how we can retain our people to meet the needs of our teeming population. Mental health nurses, they can provide vital care, rehabilitation. They can work in tertiary health centers and within the communities and families. While nurses and the psychiatrists, they are carrying out their work assiduously in making diagnosis. The problem of stigma and cultural misconceptions still remain major barriers. I'm sure the keynote will address this more in details. So what we have is a situation where many individuals often turn to spiritual healers or prayer houses before accessing the professional care. And the country can only boast of very few neuropsychiatric hospitals to serve the entire country. So we need to be thinking about how do we make progress from here. So recent policies such as the Nigerian National Mental Health Act of 2023 hold a promise to reform this landscape by bolstering the nurse workforce, integrating mental health into primary care, and expanding community engagement. I'm sure we are going to hear a lot more when we listen to the keynote address. Mental health nurses are crucial advocates and practitioners in delivering preventive, promotive, and therapeutic interventions. So their work is foundational and can reduce the stigma that we are talking about, which has constituted barrier to accessing care. They can improve access and they can also foster resilience within the Nigerian communities. So distinguished ladies and gentlemen and esteemed attendees of this important public health nursing day, for us to be able to advance mental health nursing, we should develop leadership skills by investing in education and training for public health nursing and mental health nurses. And I'm happy that that is what ASEPUTO is doing. And for all those that are represented, we still continue to plead that it's important for us to continue to invest in the education of our nurses if we expect them to really advance mental health nursing. It's also important that we promote interprofessional collaboration, working effectively with other healthcare professionals, whether in education, whether in the practice area. And the emphasis should be laid on evidence-based nursing practice, which is grounded in, that means nursing decisions are grounded in evidence that is produced through research and data generation. So investing in nursing education, investing in professional development, and supporting our public health and mental health nurses will powerfully shape the future of Nigerian public health system. And that will help us to deliver excellent nursing care at the primary healthcare level, whether to the general populace or to those who have mental issues. I will therefore urge us all to reaffirm our commitment to advancing mental health for the wellness and progress of all Nigerians. Thank you.
Thank you, Ma. Thank you for that wonderful opening remark. So we can go ahead and invite the coordinator of the SC Put Up Postgraduate Nursing Program, Professor Faith Diogo, recipient of the School of Public Health Special Recognition Award. Hello, Ma.
Yes, please. Is it the keynotes? Is it the goodwill message? Because welcome have been done.
Okay, so you can go ahead and give the go with message.
Okay. I plead that I'm allowed to stand on the existing protocol.
Okay.
Okay. This is a goodwill message from the nursing program coordinator, Professor Faith Diogo. You know, today is a postgraduate nursing day at the first annual scientific conference of School of Public Health, University of Port Harcourt. I welcome everyone here, starting from our Vice Chancellor to the Director of School of Public Health, our guest speakers, chairman, and our students. So distinguished colleagues, esteemed guests, and entire academic community, it is with great joy and deep appreciation that I deliver this goodwill message on behalf of the Department of Nursing, University of Port Harcourt. We are sincerely grateful to the School of Public Health for the standing recognition and support given to the nursing profession during this year's conference. It is with a heart full of gratitude that we acknowledge the exceptional gesture of dedicating an entire day of this prestigious conference to nursing, and further subsidizing the conference fee for our nursing students and staff is not only being generous, but also a powerful testament to the value you have placed on our contribution to public health. This thoughtful support has made it possible for more of our students and faculties to engage, to learn, and contribute meaningfully to this vital gathering of scholars. Receiving a recognition award as the nursing program coordinator is a humbling honor for me, one I accept not only for myself, but on behalf of the hardworking faculty, staff, and students of the Department of Nursing, University of Port Harcourt, who make up our resilient nursing community in this university community. This award is a symbol of shared commitment and collaboration between our departments. To the director, entire leadership of the School of Public Health, we thank you for your inclusiveness, for your foresight, and unwavering support for the nursing profession. We look forward to deepening this collaboration and exploring more ways to strengthen our shared mission of advancing public health in Nigeria and beyond. Let this be the beginning of even stronger partnership, richer dialogues, and greater impact. Thank you once again for this honor you have done to nursing, particularly Nursing Department of University of Port Harcourt. I will say, long live the University of Port Harcourt, long live School of Public Health, long live the Department of Nursing. With gratitude and pride, I am Professor Faith Diog, the coordinator and the driver of Nursing Graduate Program in the University of Port Harcourt under African Center of Excellence and Toxicological Research. This is my keynote address. Thank you very much, sir.
Thank you very much, Madam double masters, double PhD, recipient of the School of Public Health Special Recognition Award. So I don't know if we have the chairperson or her representative of Association of Nigerian Nurses and Midwives, and Professional Association of Public Health Nurses. Do we have any of them, chairperson, representative? They can indicate by raising their hands so that they can be recognized and allowed to give their goodwill messages. Have we? Anybody? Sorry? Okay, there is no one yet. I'm sure when they come, we will. Sorry? Huh?
Me.
Hello?
Hello, there is.
Okay, that's fine. Can you give your message? And after that,
Okay.
we will formally, once again, formally make the award to Professor Diog. Okay, go ahead, ma.
Okay. Good morning, everyone. I am public health nurse Chikebere Antonia Okwu, and I am the River State Secretary of Professional Association of Public Health Nurses of Nigeria. And I am of UPTH. I'm a Deputy Director of Public Health Nursing in UPTH. I am standing in for the chairman of PAFNOM, who is in another official meeting. And she has asked me on behalf of the Public Health Nurses, Professional Association of Public Health Nurses of Nigeria, to appreciate you, even as the protocol has been established. And I beg to stand on the already established protocol. But she has asked me to appreciate and thank the Vice Chancellor of University of Port Harcourt for allowing this program to go on, for allowing nursing programs to be included. And so on behalf of the association, we are thanking the VC, we are thanking the coordinator of School of Public Health, UNIPORT, and of course, SPH-UNIPORT for the inclusiveness. We are happy that you have been included. We also appreciate all your stakeholders and partners, and of course, our dear students.
Thank you.
And we thank you, and on this, your first scientific conference of your department, and we appreciate you and appreciate your tireless efforts in promoting public health and advancing nursing practice in Nigeria. All these are commendable. The postgraduate nursing education is the in thing. Nurses are embracing it, and nurses are no longer at the background, and nurses are always ready to work. And I tell you that nurses, especially public care nurses, are always to fit in anywhere you ask them. And just like Professor Bess, when you were giving your opening remarks, you made mention of so many salient points, which has been, making the public health nurses to look as if they are behind. But I thank the university for allowing all these programs to be done. And we are happy about them. And we are thanking you for the topic, for the theme of this first scientific conference, Advancing Mental Health for Sustainable Public Health in Nigeria, Evidence, Policy, and Community Action. And as we are having our nurses going abroad and so on, so few people are left to do the work. And you can tell the kind of mental torture they have, doing the work, one person doing the work of many. And you mentioned, coming to the university, just as the doctors do, there are consultants here, there are lecturers there. It is a thing of joy if that also will happen. We have been looking forward to it because we are qualified and more than qualified to take up all those posts. And coming to policy, I wish that each time policies are being made, that public health nurses should not be left behind. We are originally policy makers. We must be included. We must share our views. We are no longer, at the background. Even with the schools that have been opened, the courses that we are, that SPH-UNIPORT is offering, and even the School of Public Health is offering. We are moving forward. We have public health nurses. We have nurses that are PhD holders, that are professors, that have double masters, and so on. So we are there. We are qualified, and we are ready. We are ready to do this work. So wherever the policy is happening, whatever, we need to be included. We need to be called. We need to be involved. So I thank you so much for recognizing this critical role public health nurses play in improving health outcomes, prevention of diseases, and promotion of health equity. Therefore, advocating for policies that will support public health is of great importance. As we continue to work challenges facing our nation, we remain committed to supporting and empowering our members to provide high quality care and leadership. I plead that the public health nurses should also be involved in policy making, as I have said. And I thank you for the School of Public Health Nursing programs. And I tell you, together, if we work together, we will make this nation better. We will make public health better. We will make the health of all Nigerians better. And we are going to improve on the education of the younger ones. And we are going to train them to take our place when we are no more there. And this also is very, very important. But if these nurses are allowed to go away like that, we wouldn't have anyone to take over from us. So I thank you so very much. People are doing very well. I thank SPH-UNIPORT for the beautiful nursing courses they are doing. I appreciate you. I bring you love from from Professional Association of Public Health Nurses. Thank you so very much. God bless you.
Thank you very much, Metron, Rotarian.
Thank you.
Ugu.
Thank you.
Thank you very much. One of, anyway, we used to call them the glamour girls probably 20 years ago, but she's still beautiful. Nurses are known to be very beautiful. And they have a lot of things upstairs too. So brain and beauty you can find in nurses. Thank you very much. Thank you, Metro Rugu. I think we can now go and we'll now formally present the award once again to Professor Faith Diogo. I think we have a lot to learn from her. Double. And I noticed that these double masters, double PhDs are very, very, they are very, very common amongst nurses, especially those in academics. And we probably know why, the reason, because the postgraduate nursing program came a little bit later. So a lot of them went into other programs. But the good thing is that they are retracing their steps and having programs in nursing and in nursing science. Thank you very much. Let's formally make that award again to Professor Diogo.
Professor Faith Diogo, recipient of the University of Port Harcourt School of Public Health Special Recognition Award. Professor Diogo is a registered nurse and midwife and Nigeria's first professor of midwifery. She is honored for her pioneering contributions to postgraduate nursing education in Nigeria and as coordinator of the nursing programs of SPH-UNIPORT at the University of Port Harcourt. Her journey began with undergraduate training in nursing and midwifery at the University of Ibadan. She later pursued postgraduate degrees in educational psychology, earning her master's and PhD at the University of Port Harcourt. She was then appointed a lecturer in nursing science, which inspired her to take a second master's degree in midwifery at the University of Nottingham, and later a PhD in midwifery from the University of Chester in the United Kingdom in 2017. In 2022, she attained a historic milestone, becoming Nigeria's first female professor of midwifery. As coordinator of SPH-UNIPORT nursing programs, she championed the innovative online flipped classroom model of postgraduate education. This model created flexible learning opportunities for practical nurses, allowing tens of students across different specialties of nursing science to successfully train and graduate despite the challenges of full-time employment. For her groundbreaking innovations, her leadership in postgraduate nursing education, and her trailblazing role in midwifery, the School of Public Health proudly presents a special recognition award to Professor Faith Diogo, double master's degree holder, double doctorate degree holder, Nigeria's first doctorate degree holder in midwifery, Nigeria's first professor of midwifery, inventor of the upright birthing chair, recipient of the University of Port Harcourt School of Public Health Special Recognition Award. Congratulations, ma'am.
I feel so honored. I feel so elated. I feel so favored. This award means a lot to me because it shows me that as I'm working, some persons are acknowledging my efforts. So it is like a push for me to do more because the one little one I have done is being acknowledged. That means more is required of me to do, and I'm ready by God's grace to do my best in this university.
Thank you very much. We have to give honor to whom honor is due. Professor Diogo, working within the SPH-UNIPORT ecosystem, has been able to revolutionize postgraduate nursing education in Nigeria. And so we have given her this award to encourage her to do more. And then, just as we stated in my opening welcome address, we want the programs to be expanded so that we have programs in each of the subspecialties of nursing to fully staff the nursing programs in Nigeria. As at the last count, we have at least 65 universities with nursing programs in Nigeria, and they need a lot of staff. They need a lot of staff, and they need these lecturers to have the qualifications in these disciplines, in these subspecialties, so that you have specialist lecturers teaching the subspecialties. Thank you very much, Professor Faith Diogo. And I have to also say that, she has a patent, that baton chair. Although she has not been exposing that chair, perhaps she's afraid of that chair being copied. Thank you very much, Professor Diogo. So we will now take the citation of the keynote speaker, the citation of the keynote speaker, and the keynote speaker, Dr. Stanley Njaka. I hope August Stanley is there. Hello, Dr. Njaka. Okay, he said, okay, that's fine. So let's have his citation, and after that, he will give his keynote address.
Dr. Stanley Njaka won the unanimous votes to give the keynote address on day 13 of the first annual scientific conference of the University of Port Harcourt School of Public Health. He won the votes for his professional training in public health, nursing, and for being an engaging lecturer and mentor. He earned his Bachelor of Nursing Science degree from Ebonyi State University, Abakaliki in 2012. As the best graduating student of nursing and a Master of Science degree in mental health nursing from the same university in 2019. He took another master's degree in occupational health and environmental health nursing in 2021 from University Science Malaysia, and PhD in psychiatric and mental health nursing in 2021 from the same university. Dr. Njaka was appointed a lecturer of the Department of Nursing Sciences in his alma mater, the Ebonyi State University in 2016, and is also an adjunct lecturer at the Evangel University Abakaliki. Dr. Njaka has supervised several research projects at undergraduate and postgraduate levels and has published more than 21 peer-reviewed articles. Distinguished guests, lecturers, students, ladies and gentlemen, behold Dr. Stanley Njaka, a nurse registered in Nigeria and the United States, registered public health nurse, award-winning mental health nurse, and keynote speaker on day 13 of the first annual scientific conference of the University of Port Harcourt School of Public Health.
Thank you very much. So over to you, Dr. Stanley Njaka, for your keynote lecture. Hello, sir. Is there? Hello, sir. You can unmute. I think he has. He can share his slides too. His slide too. Hello, Dr. Njaka. You can unmute and then give your keynote address. Okay. What is there? Okay. Sorry, I'm sure that he has some network challenges, but he will be with us soon. You know, one thing that is noticeable is that once people assume that nursing is a profession for ladies, beautiful ladies, I must add. But once you see a man involved, they are usually very, very passionate and very, very good. And I must say that Stanley Njaka is one of such. And even in the University of Port Harcourt, we also have very, very brilliant, dedicated, and hardworking nurses in that department. In fact, once you interact with them, you know that they have a lot of stuff, a lot of passion. So yes, I know of one that the way he speaks, I'm sure that he's probably not born in Nigeria because I don't know. Dr. Leke.
Dr. Leke.
The way he speaks, at times I wonder whether he's yeah. So very hardworking, very intelligent, and very passionate. And we also have Magnus. Magnus is very ebullient. I think I learned that he was a former student union leader, and he's doing very well. And once you see them, you know that they are very, 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 very good, very, very good. And it's not they went into the nursing profession not as an afterthought, but because of their passion. Yeah, their passion. Their passion to take care of people, especially in their their lowest moments. So if an adult becomes sick, he becomes a child. Eh? He becomes a child, and it's probably only the nurses that can even take care of an adult behaving like a child. So we have to commend them. We have to commend them. And how far? Is still there? Okay, he's back.
It's still back. Okay.
He's back. I'm sure that he's looking for a better network connection. I remember at times you will go to a field where the network is not too good. They say you have to hang your phone on the tree and use an earpiece to listen, because once you bring the phone down, the network will disappear. So
yeah, he's back.
Okay, he's back. Hello, sir. So if you are fully back, you can unmute and then give your lecture. Professor Dr. Njaka.
Yes, sir. Good morning.
Okay,
sir.
that is fine. That is fine. That is fine. Thank you very much and welcome, sir.
Sorry for the network glitching. I was trying to unmute myself, but I wasn't being allowed. So it was only the admin that can do that.
No problem. No problem. So you can go ahead with your lecture.
Okay, bro. Let me share my slide.
Yes, sir.
Yeah. Good morning, the Vice Chancellor, University of Port Harcourt, the DVCs here present, the Director of School of Public Health, University of Port Harcourt, dear Professor Best. Oh, the Coordinator, the Nursing Program, School of Postgraduate, School of Public Health, Professor Faith Diogo. The Chairman of today's event, Professor Edet. The leadership of Nursing and Midwifery Council of Nigeria here present, the members of Professional Association of Public Health Nurses, dear postgraduate students, the faculty members, ladies and gentlemen, permit me to stand on already established protocol. I am by name Njaka Stanley, a registered public health nurse, a registered nurse, MSc degree holder, and PhD holder in psychiatric and mental health nursing. I am privileged to be the keynote speaker on this auspicious occasion of first scientific conference of the University of Port Harcourt School of Public Health Nursing. I shall be talking briefly on the topic, Advancing Mental Health for Sustainable Public Health in Nigeria, Evidence, Policy, and Community Action. My presentation shall cover the following outline. We'll look at brief introduction of mental health, the burden of mental health challenges.
Hello,
Sorry,
Dr.
can
Njaka.
you move the slide? Yes.
Yes, I think it
Stanley.
has to, if you can put it on slideshow.
Yes,
The
I'm
way
moving the
it
slide
is-
for us. Yes.
The way it is, it may be difficult to move, except it
Let's put it on slideshow then.
Mine is on slideshow.
I know. That's the problem. At times it happens like that because we are not seeing it on slideshow. What? Sorry? Okay,
It's
stop
not on
sharing
slideshow.
and then share again. Stop share. Okay, can you put it on slideshow?
Okay. Is it better now?
You can continue. It's not on slideshow.
The problem is if we were able to change his slide.
He will be able to change the slide.
So if you stop sharing and then share again, perhaps it will be better. Yeah.
That's what I want to do now. Let me try again.
Okay.
Just a moment, please. It's coming up. Please, I'm having some network glitches here. Just a moment, please. I'm so sorry about that. I don't know why I started now. All this while it has been.
It does happen.
Okay, so Jaka, what exactly is the problem now?
Dr. Stanley. Dr. Stanley.
Listen there. Okay.
Are you making progress?
I think he has.
Can we go to, yes, can we go to another activity? We can still have his lecture when he's ready. Yeah.
Okay. The other one, that will be the first section. Except we'll just take the panel discussion.
It's a panel that we can take.
Okay,
Yeah.
can we take the panel discussion while it sorts out?
Yeah, geez,
because it may take a while. Probably he has to change his network altogether.
Okay. Okay, so we can, let's take the panel discussion. It's coming a little bit earlier than scheduled, but let's just...
but are they around? Are the panelists around?
Let me confirm if they're around. Dr. Blessing Oyije. Hello, ma. Is she around? Blessing. Dr. Blessing Tochukwu Oyije.
Okay, there's another activity there, cultural display or something.
Okay.
But that one is on site.
No. Anyway, perhaps we can take that while we wait for him once he comes.
Because
it means there won't be any break after because it's supposed to be that break before we'll take the cultural display.
Okay, but if we are, instead of going to panel discussion, because that one is slated for 12, and some of the people may not be available now. So.
Okay. Okay, let's just probably small interactions.
But it wasn't showing at you people's end. It was showing at my own end.
Okay, you are there. Okay, he's back. He seems he's answering a phone.
Now before taking a flight show.
No, it's all right. You can share it. Let's see. And the only thing is that once it happens like that, you may find it difficult to move your slide.
Okay, if you can deliver the lecture, and we make do with
okay, you can share it. Please. No problem. Don't be at times once you start having network problems, you.
Except he wants to send the presentation to you, and then you be the one that will be
there for him.
Yes. That's another way.
Yes. The presentation won't be that smooth once it's done. Hello, Stanley. Just share it. Let's see. Don't worry. Just share it. Let's see.
The keynote is very important to us. So
yeah, it is. Yeah.
We need to take it and then.
That's.
Professor Best.
Yeah.
Yes,
What
I want to sharing.
Okay. Let's see. Okay, yeah, so let's share it.
So I was saying I want to say a special thank you to you for having us in their minds. You can see how you did the welcome address, for nurses and nursing program. You spoke as if we are even a nurse. So much knowledge about our concerns, about our program, about everything that concerns nursing. It was very, very surprising to me that you know so much about nursing profession. So we appreciate that interest, and we appreciate that you dip so deep to find out our program and our challenges, and you actually highlighted all of it, which we will not take for granted.
I think we can talk because we have the chairperson and you people are very senior members of the nursing profession. Perhaps we can just think about that. But the first thing is this: these other programs, are you likely?
Yeah.
What is the likelihood of starting those programs in yes, and
that would
because I'm just imagining in the medical school we have departments, and the nursing program is likely to start moving towards that direction.
Yes.
So which means that you should have lecturers in each of those subspecialties, and we need the manpower. Are you in SPH-UNIPORT or even I don't know. Let me not encourage mutiny. But I'm just thinking, if I say a special center.
We will think around it. Yes, we will think through it. The thing is that those programs are post basic, and they are only going to be postgraduate diplomas. But we have other core courses that we do as a master's and PhD that is approved by the council. Like the chairperson said, they have already marshaled out the programs, postgraduate programs in nursing. It has even gone to AUC, and we are waiting to kick off.
Okay.
Many of them.
Because
so,
I'm just thinking, like in the medical school, where you have all those, like even in some universities, like I think NDU, they have a faculty of nursing. And if you can't have a faculty where you have one department.
No, for us in UNIPORT, we
cannot have a faculty with one department. Usually, when we move to that faculty level, actually, many universities are now
faculty.
The latest one is University of Ibadan, at least where you think is very difficult. They have become a faculty, and that means you have several departments. I know for medicine has gone very far. They will have like 20-something departments. But for us now, maybe have like 5 departments.
Okay, so if you have 5, it means that you have to have
expand.
It means that you have to have lecturers in those departments.
You are very, very correct.
Yes.
And that's why a center like SPH-UNIPORT is quite important to us.
Yes.
Because
pushing
they are
out
able to complement what is happening in the public and private universities.
Yes.
And good enough, the programs are accredited. You know that NUC only started accrediting postgraduate program in 2014. And now, going forward, their plan is that when they come for undergraduate, they will also accredit the postgraduate program for the universities that are are running them. When you mentioned 65 universities running nursing programs, I'm wondering whether they are accredited programs actually.
Yeah, no. I actually got the information from the
net
website of the Nursing and Midwifery Council.
Yeah.
65.
Is there. Is there.
Okay. Okay,
there.
running a postgraduate program.
No, not running postgraduate, but undergraduates.
Okay, very good. Okay, if it's undergraduate,
will we be able to undertake those specialties? Because we are now having a college of nursing, and they will be able to take up all those specialties as you were pointing.
Yeah, that would be nice.
Yes.
That would be nice. That would be nice.
See many basic colleges for those programs.
Okay. I think we have the slides.
Yes.
We have the slides now.
And we have the Dr. Njaka himself staring at us. So he's ready.
Okay. Dr. Njaka, you can go ahead.
Okay.
Okay, Prof. Please,
don't worry, we understand though. We understand.
We are all from this Niger, so we understand.
I want to take out this time to most sincerely apologize for the technical glitches.
Apology accepted.
So far. It was never
Dr. Stanley, start before your network begins to twitch.
I'm so sorry. You have to permit me to stand on already existing protocol for want of time. Like I said before, I shall be presenting on the topic advancing mental health for sustainable public health in Nigeria, evidence, policy, and community action. Please, next slide. The presentation shall cover the following outline: a brief introduction of mental health, public health, and what it means to have a sustainable public health. We shall look at the burden of mental health challenges. We shall also look at the impact of mental disorders on public health. We will look at the evidence. What is the research saying, or the data telling us about mental health in Nigeria? And what are the policy issues, the community actions, key strategies for advancing mental health, and thereafter we'll conclude. Next slide. Blessing, please. Next slide. Hello. Can you hear me, please? Can you hear me?
We can hear you, yes.
Okay. Now, mental health has been defined by World Health Organization in addition to other experts in the field. World Health Organization defined it as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, work well, and contribute to their community development. As we all know, life is full of stresses. Life is diversified. The various processes of life deals with different types of stress that goes with it. And that is why, on that basis, the World Health Organization defined mental health as the state of mental well-being, where an individual has been able to manage the stressors coming from inside and outside of him, and able to work well, contribute to the meaningful development of his community. Now, according to CDC, the Center for Disease Control, public health is the science of protecting, improving the health of the people and their community. So the focus of public health is promoting healthy lifestyles, researching diseases, injury prevention, detecting, preventing, and responding to various diseases, including mental health. Now, public health becomes sustainable or a sustainable public health is a forward-thinking approach that ensures that the present and the future health of the community and the people therein by integrating environmental, social, economic well-being within the planetary limits. Sustainable public health in this instance goes beyond traditional public health by recognizing the inextricable link, that there is a link between human health and the health of the planet, requiring actions like promoting equity, adequate financing of the health, and then fostering community-wide resilience. Improved mental health is not only vital, but is the bedrock of the totality of human health. It underpins the overall well-being of any individual. Improved mental health reduces mortality and morbidity rates because evidence has shown that people with mental disorders of various types, be it depression, anxiety, bipolar disorder, or schizophrenia, or what have you, experiences increased mortality rates. They die 10 to 20 years earlier than normal people without mental disorders. Now, once the mental health of the people are improved, the likelihood of reducing mortality and morbidity is there. Then this increased mortality emanates from the fact that people with mental disorders experience what we call comorbidity. A lot of other physical disorders came in and then compounded their problem. Now, improved mental health also enhances the quality of life of the people. People are able to enjoy what they do as work. People are able to enjoy their family, and people are able to feel satisfied with the social, psychological, and physical aspect of their health. So the quality of life of the people is enhanced by improving their mental well-being. Now, improved mental health also fosters positive physical outcome. You can agree with me that it is only those who are psychologically sound that can comply with health promotion activities, disease prevention activities, and curative measures as may be recommended based on their health condition. Now, improved psychological well-being also fosters positive relationships amongst family members. Now, the following, based on the above advantages of improved mental health, improving mental health has been seen currently as an emergency concern for public health professionals, according to Taliban University of Public Health and Tropical Medicine. Now, burden of mental health disorders. The burden of mental health disorders is not only limited to Nigeria. It's a global problem affecting both the developed and the developing nations. Globally, mental disorders affect over 970 million people as far back as 2019, and are accounting for more than 15% of years of life lost due to diseases. So it is a very prevalent disorder, more than some of the physical ailments we take priority or place priority on. About 418 million disability adjusted life years. That is the number of years individuals with mental disorders spent trying to cope with disease-related disabilities are attributed to mental disorders. So of all the years spent due to burden of disorders, mental disorders account for 16% of the global disability adjusted life years, according to Daniel et al. 2022. Now, the economic impact of diseases, of mental disorders cannot be overestimated. Globally, it is estimated to be $5 trillion annually. And at a regional level, the losses could account for between 4% of gross domestic product lost in Eastern Sub-Saharan Africa and 8% in high-income North American countries. So these were the issues at the regional level. At African level, it's responsible for 4% loss in a gross domestic product. In Nigeria, the annual burden of mental disorder stood at 21.6 billion naira as far back as 2012. The recent evidence on the national burden of mental disorder is not recent, is not available, as research did not provide any detail on that. Now, one may ask, why are we stressing ourselves advancing mental health, whereas the center of concern should be public health? Let me tell you that there is no public health without mental health. Take away the mental health of a person, whatsoever you are doing to sustain public health, I will tell you authoritatively as an expert, it is an effort in futility. The center of any individual is his brain. Once the brain of a person is not intact, the body, the eyes, the leg, every other part of his being is not intact. The brain of an individual connects to every other part of it. So once you promote the brain, the mental status of the person, you are promoting every other part of that person. So therefore, mental disorders exert deleterious impacts on the public well-being, on the public health of the people. And how does it do it? Let us look at the family life, for instance. The mental disorders disrupt social structure. One of the things we observe in people with mental disorders is disruption in their behavior, disruption in their relationship, disruption in their ability to work. And once the behavior of a person is disrupted, once the relationship is disrupted, then the family structure is disorganized. The normal cordial relationship, cordial existence between the wife, the husband, and the children, or the expanded family is altered. And then the family aspect of the public health is affected. Now, a family where the breadwinners suffer mental disorders, there is every increased tendency that their children will suffer educational attainment. And once the training of the children in terms of education is disrupted, I tell you, the child stands a greater chance of deviating, of facing serious risk in life. As we know, adults and children are characterized by experimental lifestyle. So what we need to guide them is to educate them. And once you fail to educate them, there are people out there waiting to give them the other side of education. So a disruption in the family lifestyle by mental disorders can disrupt not the present, not only the present, but the future of the children and the future of the community at large. 2, premature death. Mental disorders impact the life of the people. It shortens the lifespan of the people by 10 to 20 years, according to World Health Organization 2019. So people who suffer one form of mental disorders are more likely to die 10 to 20 years younger than people without mental disorders. The economic burden. As you can agree with me, that the collective economic output of any country, of any community, of any organization is dependent on the summation of the individual economic output, the productivity of the individuals employed. And once the individuals employed are able to produce, then if they are summed up, then that is where you can say the organizations are progressing. But where the productivity of the individuals are hampered by mental disorders, then the productivity of the organization, the school, the community, the country is also hampered. So mental disorder does not only affect the economic output of the individual, but also affects the economic output of the nation and the country, on the continent at large. Then evidence shows that mental disorders related economic burden stood at 21 billion naira annually among Nigerian society, according to Oluyemi et al. 2012. Next slide, please. Now, what is the evidence showing? Now we are advocating that there should be advancement in mental health. What evidence do we have to back up our lobby, to back up our policy reform, to back up our advocacy for advancement in mental health? Now, let us see what research has to tell us. Recently, in Nigeria, there is no nationwide survey of mental disorders. The last nationwide survey of mental disorders was in 2000, in the year 2000, by African Polling Institute, where they estimated that between 20 to 30% of Nigerians live with mental disorders. However, World Health Organization came up in 2022 estimating that over 30% of Nigerians live with diagnosable mental disorders. Now, what does this imply? A 30% of 200 million, that is over 60 million Nigerians, live with diagnosable mental disorder. This is outrageous. Which other physical disorder has this type of prevalence in Nigeria? When Ebola emanated in Nigeria as far back as earlier 2016, 2015, 2017, 18, or thereabout, Nigeria ran around. The Center for Disease Control ran around. The public health officers stood to their toe until the problem was arrested. How prevalent was it then? How many Nigerians suffered it? Why is over 60 million Nigerians living with mental disorders being neglected? Is this not a substantial evidence to push that there should be an improvement in mental health service delivery in the country, where over 60% of Nigerians suffer mental disorders and their related burden or adverse effect? Nigeria has been shown to have the Africa's highest load of depression and ranks 5th in the world for suicide cases, according to Suroye et al. 2021.
It's 15, we are saying here.
Evidence also shows that evidence also shows that there is lack of community-based mental health services in every part of Nigeria. Go to our primary health centers, there is no trace, no mental health drug, no units assigned to mental health services. Whereas this is the primary preventive stage of every disorder. As far back as 19th century, World Health Organization advocated for adoption of community-based mental health service delivery. But here in Nigeria, where are we today? There is no evidence to show. Like Professor Edet said during her welcome speech, she pointed out the fact that we have only regional psychiatric hospitals, inpatient services, no preventive places, no preventive stage of care. Have you ever seen a country where the level of care for an enormous population, over 60 million people, is based at a specialist level? No preventive stage, no tertiary stage, no secondary stage, only tertiary stage. It does not make sense. There is need to advance mental health care delivery. Often, people with mental disorders have been shown to be often confined in the various families where their family members care for them without any knowledge of what mental disorder is and how best to care for them. About 80% of people with severe mental disorders in Nigeria lack access to mental health services from professionals at all levels of care. Next slide, please. World Health recommended that there should be one psychiatrist to 10,000 patients. That is the standard. That for every 10,000 patients, there should be one psychiatrist who specializes in mental health service delivery. But in Nigeria, what do we have? According to the Association of Psychiatrists of Nigeria, 2018, we have between 150 to 250 psychiatrists. The same was reported by Kehinde et al. 2024. Now, there are 4 to 5 psychiatric nurses per 100,000 Nigerians, according to Damulag 2021. And there are less than 7% of prospective nurses that are interested in this specialty area. So it is not just that we are lacking professionals, but the prospective nurses, prospective medical where I assessed all the schools training nurses in Ebonyi State, I can tell you that the finding was heart-wrenching, that less than 6% of prospective nurses showed interest to choose a career in psychiatry. When I joined this Zoom meeting, I quickly went through the chat where the students hearing identified their specialties. I can tell you I did not even see one postgraduate student who chose mental health as a specialty. Why? Is it that our psychological status or psychological health is no longer important? Why are we neglecting all important specialty areas? And there are other people are flowing into other specialty areas, whereas mental health is allowed to suffer. Poor funding is another evidence. Only 3 to 4%, according to research, of the Nigerian national budget for health is spent on mental health issues. And this 100% of this 3 to 4% is spent on regional psychiatric hospitals. And one may be moved to ask, what happens to the preventive stage, the community-based, the primary health care? What happens to awareness creation campaign? What happens to public sensitization about mental health and the disorders thereof? That the whole budget made for mental health goes to inpatient services in the regional hospital. It is abnormal. It shouldn't be like that. To add to this anomaly, you could see when you go through the policy of National Health Insurance Scheme, mental health is completely expunged. Why? Because the country Nigeria feels it is the disease of the poor, and as such should not be recognized. That is very bad. Those evidences, as outlined, tells us that there is a need for us to advance mental health services now, such that our public health will be sustainable. Now, what is the policy telling us? Mental health policy issues. Yes, of recent in 2021, Nigerian lawmakers woke up and started advocating for a reform in the ancient of days Lunacy Act of 1958. This policy advocacy came on board in 2021, and that is why we have what we call National Mental Health Act of today that was adopted or signed into law in 2023 by the then President of Nigeria. Now, this current health policy lays emphasis on human rights, non-discrimination, and the integration of mental health services into the general healthcare system. The policy goal of this mental health policy is to promote well-being by providing equitable access to preventive, therapeutic, and rehabilitative care for all Nigerians. Now that the policy provides this, one may ask, for 2 years after the policy was signed into law, what is the level of implementation? There is no traceable evidence anywhere to show that this policy has been even been communicated to the people. If I take a census amongst the participants of this conference, majority of the participants here can tell me that they are not aware of this policy, especially among students. Our community members are not aware. Even though the policy is a very good foundation, a very good advancement in healthcare delivery in the country, but how well has it been communicated to the people? So that the people will know that there is no need stigmatizing, there is no need discriminating, that the human right of the people with mental disorders must be upheld. And then it emphasizes integration of mental health into general health care. How far have we gone? How many of our primary health centers now has a unit designated for mental health service delivery? In other aspects of mental health, in other aspects of public health, we have child welfare, women welfare, family planning, and all those things. Where is the mental health welfare package? Where are we heading to? Now, the Lunacy Act of 1958 was the earliest policy Nigerian government adopted. This policy did more harm than good. However, as at that time, it may be perceived to have done some good, but in the real sense of it, the Lunacy Act of 1958 propagated the stigma against mental health disorder we have today, because it empowers magistrates, law enforcement agents to just grab people with mental disorders and throw them into the hospital without recourse to the fact that they are human beings with rights. The Comprehensive World Health Mental Health Action Plan was adopted in 2013, and it is to run till 2030, just 5 years ago. And one may ask ourselves, how far is Nigeria in it? The emphasis of this comprehensive mental health act is on preventive basis and community-based mental health service delivery. Where are we in Nigerians? The national health policy of Nigeria needs to be amended to include public health, mental health service delivery. It is an essential component of public health. Now, what is the duty of community here? Why are we considering community actions when we talk about advancing mental health for sustainable public health? Let me tell you something we need to know. The earliest diagnosis of mental health disorders or mental disorders is usually carried out or done at the community level. Take, for instance, Professor Faith, sorry to use you. We are all students here, postgraduate students here. You are our course rep, Prof. And because you are our course rep, we have known a bit of your personality. We know how you react to situations that want celebration. We know how Professor Faith jumps at it and celebrates. Everybody in the class makes merry. If it is a situation that calls for being sober or being sad, we know how Faith reacts to and consoles every other member of the class. But all of a sudden, we, the class members, noticed the slightest change in the personality of our course rep. What then do we do? What will come to our mind as community members of the same class is that, it's like, this is our course rep. This is not what we know her to be. It's like she is deviating. Maybe we need to take her to hospital to seek a professional advice. That is the earliest diagnosis we can make at our stage as community members. And that is why for mental health to be promoted and advanced, and for public health to be sustainable, community action is inevitable. Number one, there must be sustainable mental health via the community approach. Two, there must be a community-led initiative. Such initiatives include peer group support, public sensitization campaigns, educational sections. Let me tell you, as a department of nursing, as a school of postgraduate public health, you are a community. The staff there constitute community. The students there constitute community. There are lots the staff can do, the school can do, the students can do to promote their mental health. Number one of such actions the community can take at School of Public Health, UNIPORT, is one, establishment of what we call mental health club, maybe at the undergraduate level, where the students are allowed to share their psychological challenges with their peers, moderated or guided by an expert, a counselor. There should also be an opportunity for students to take a break from a prolonged period of academic engagement. This is very necessary because the students need to cool off from stresses so that they get rejuvenated and bounce back. I give you an instance. One of the days where I was doing a program in Malaysia. One of my friends in Malaysia, a Nigerian, had an issue with the supervisor where the supervisor was not responsive to all his mails. So one day he entered the toilet in Malaysia, locked himself up, and severed the brachial artery. He used a sharp object and severed the brachial artery that he was bleeding profusely. His attempt was to take his life, but unfortunately, somebody met him there, and that was how he was saved. That guy took that step because he was feeling frustrated. The supervisor was no longer supportive. The supervisor was no longer attending to his mails. He felt the money he spent traveling to Malaysia was becoming waste. So the only thing he could do to take his life. Please, the director of School of Public Health, I want to please start this advancement with your school. Let there be a counseling unit of your school where postgraduate students who have challenges in one way or the other are called and supported psychologically. There's what we call psychological first aid. If you notice any of your students is derailing psychologically, give them the hope. Call them back, draw them back, give them hope. that these things are achievable, but just with time. I want to encourage you, supervisors here present, there is need, especially for masters and PhD students, after long period of academic engagement, encourage them to take a break. 1 week, 2 weeks, and rest, get rejuvenated and bounce back. By so doing, their mental health status would have been refreshed. They will go back and do better. Now, what else do you need to do? In the community areas, there is need to train lay health workers for early screening of mental health issues. There is need. Since the community are the first people to detect changes in mental health status of anybody around them, the need exists that mental health professionals take up this challenge, do a public campaign, let the people in the community know the little about mental health and what they can do to support each other. It is very, very vital. There is also a need to integrate mental health into existing health systems. We have what we call child protection, early child education, and all what's not. Let mental health form component of them. Yes, one may say that mental health is a component of primary health care. But if I may ask, how far have we gone in that component? Immunization takes the order of the day in Nigeria. I'm not saying immunization is bad. I didn't say so. But remember, it is only a woman who is sound mentally that can take his or her child for immunization. It is only a man who is sound mentally that can support the wife to go for family planning. So invariably, mental health is at the center of it all. Now, community engaged approaches, an active participation. Primary health care is community ownership, community participation, community mobilization. Why are the communities not being mobilized to participate in mental health advancement? Let the communities be involved. Let the church leaders be involved. Let the management of institutions be involved. Management of institutions can set up a recreational facility in their places of work so that after work, the staff can go and ease off. I give you an instance of what you may do if it is feasible in Nigeria, and I know it is feasible. Back there in Malaysia, once it is 2 p.m. of every working day, it is break time, 1 hour break time, from 2 p.m. to 3 p.m. Everybody locks the office, go out refreshing, eat food, whatever you have to eat, and return back at exactly 3 p.m. How far can we do that in School of Public Health, UNIPORT, and other schools in Nigeria? That moment, that 1 hour freedom, maybe to interact with colleagues, go and ease off, go and buy water and drink, it takes the stress off the neck of the person. It gives the person an opportunity to ease off and return back and do better. Productivity is not dependent on the hours spent on the work. It is not. It is dependent on the level of commitment. That few hours you spent, how committed were you at it? That is what matters. Give them a little time, let them ease up and bounce back. Now, stigma reduction. The stigma against mental health issue is common in Nigeria, and also in some other part of African countries, but it's very common in communities. And what do we need to do? There is need to speak up. Say the truth. Speak against stigma. Speak against misconception. People believe that mental disorders are caused by witchcraft. Gone are those days that were never true. It is pure lie. Mental disorders are most commonly associated with imbalances between the excitatory and inhibitory neurotransmitters. And that is why the antipsychotic drugs we use in managing mental disorders, their mechanism of action is based on interaction with the neurotransmitter. We have what we call the predisposing, precipitating, and perpetuating factors of mental disorders. Genetic history, family history, being a twin, stress, substance abuse, trauma, and all whatnot. These are associated with it. Mental disorder is not a disease associated with witchcraft. It is not a disease of the poor. Yes, someone may say that being in the lower state of economic status may predispose or precipitate mental disorders. Yes, it may. But then there are people who live wealthy today and yet they have mental disorders. There are people who live in the lower stage of life, in the lower cadre of economic status today, yet they don't have mental disorder. It is a disease that respects no status. It can occur in the rich, it can occur in the poor. There is need for all of us, professionals, be you a teacher, be you a clinician, be you a student, or be you a church leader, need to speak up so that stigma against people with mental disorders will go away. Mental disorder can be managed, properly managed, if instituted on time. And that is why community mobilization for early detection of mental disorders is paramount. Every hand must be on deck. Educate yourself and educate others. Speak up where necessary against stigma. Next slide, please. Promoting a positive lifestyle, I've talked about this. Physical activity. Let there be a recreational facility in every workplace. Let there be a recreational facility for students to use. Let there be an opportunity to rest well after daily work. Once you leave office, go back to your home, rest, sleep well. Do not deny yourself sleep. It is very important. Please, next slide. Go back to the last slide, please. Okay, now creating a supportive environment. There should be an in-school counseling services, a school-based mental health clubs, which will help to promote psychological well-being among the undergraduate and the postgraduate alike. Now, on the next slide, advancing mental health for sustainable development. This is a call for governmental, non-governmental, global, and local partners to intensify efforts to achieve the World Health Comprehensive Mental Health Plan by 2023, according to World Health Organization. And this can be achieved through the collaborative effort of every stakeholder, every professional, every nurse, every psychiatrist, every administrator, every policymaker, and virtually everybody must come on board. And this calls for equitable financing of mental health services, reforming laws and policies, investing in mental health workforce, and expanding community-based and person-centered care. Now let us look at the key strategies. Now we have seen the need to advance mental health. We have seen the policy weakness. We have seen the community actions. We have seen the evidence based on research. What then do we need to do? Research. As we all know, there is no advancement, there is no reformation, there is no promotion, or there is no inventory without research. At present, the current national survey on prevalence of mental disorders and other aspects of mental disorder is very low. The last was done since 2021. However, I am not saying that there are no fragmented researches in different states and regions. There are. But then for us to make a case, a strong case, there must be a national-wide based survey of mental disorders. This should be done. Both the academics should step up, the clinicians should step up, the policymakers should step up. Let there be enormous empirical evidence upon which advocacy can be based. Equitable financing. Ensuring that resources are distributed fairly and that it reaches those in need is very, very paramount. 3 to 4% of a national budget being spent on mental health, it is an insult to the country Nigeria. It is an insult to the mental health status of our dear people. Where over 60%, over 60 million people live with mental disorder, and you are spending just 3 to 4%. It is bad. There is need for improvement. Legal and policy reform. Stigma has been known to contribute greatly to the reason people don't like to seek professional health care. A need exists to conduct a nationwide, a public campaign against stigma. Let the people know that stigma is doing more harm, if at all there is any good. Let the people know that mental health is not a disease associated with particular status. Let the people know that mental disorder is not a disease of the poor. Let them know that it is not a disease associated with witchcraft. Let them know the exact cause of this problem, so that stigma will go away and the people will be free, and the mental health status of the people will be promoted. Workforce development. We have also seen from what statistics says, from what Professor Edet presented, that the number of mental health professionals in Nigeria is not just grossly adequate, but very, very poor. Where the World Health Organization recommended one psychiatrist per 10,000 people living with mental disorders, and we have less than 250. It means if you divide 250 by over 200 million Nigerians, it means we're having less than one psychiatrist per 1 million Nigerians. Nigeria government, non-governmental organizations need to step up to ensure workforce development. And how can this be done? Scholarship can be granted to those who are interested in psychiatry so that this area can be promoted. Refer back to what is happening in UK, where you come in as a nurse, an adult nurse trained in general nursing, and you develop interest in psychiatry. They will bring you in, give you incentive, give you some training, and register you as a psychiatric nurse. Same can be done here. And policies should be formulated where scholarship can be made available to those aspiring to specialize in mental health and psychiatry. Please, next slide. Okay, expanded community-based services should also come on board. It is long overdue. Let mental health service delivery return to the community where the people dwell in. What is the benefit of returning mental health services to the community? It promotes acceptance of mental health services amongst the people. It promotes ownership. And once the people view mental health as being owned by them, they will accept it. Utilization will be improved, and then mental health status will be generally improved. Next slide. In conclusion, to advance mental health care, all hands must be on deck. The researcher, the educator, the administrator, the clinician, the community leaders, the religious leaders, and every single individual must step up. There is no sustainable public health without mental health. Mental health is at the core of it. The key strategies involve research, policy reform, community-based measures, and human resources development and proper funding. Thank you, and God bless you.
Thank you very much. Thank you very much for such a wonderful lecture. Please, can we rise and give him a standing ovation? Thank you very much. Dr. Njaka actually came highly recommended, and he has not disappointed. Thank you very much. In fact, the network wanted to mess you up, but in spite of that, you have delivered a wonderful lecture. Thank you very much. So we can now resume our seats. Thank you very much, Dr. Njaka. So we are going to take a brief break to watch cultural displays. And after that, we'll come back for the panel discussion. And the discussion will center around postgraduate nursing education in Nigeria. Of course, that will extend into the practice and, of course, the teaching of undergraduate students. And we have Dr. Blessing Onyije of Chukwuemeka Ojukwu University, Dr. Deborah Onisele of Redeemers University, Dr. Tabitha Leslie of Babcock University, our own Mrs. Blessing Oyemachi Osigbe, and then Ms. Akalo Obasi, and then Nurse Vera Nsigbe. But before that, I will give opportunity to the public health, the students, the postgraduate students of SPH-UNIPORT to respond to the award being given to their Professor Diogo. I think to give the remark will be Mr. Carlo Obasi. Hello, sir. Hello, Carlo. Can you please just identify yourself so that they can unmute so that they'll.
Okay.
Okay. Okay, go on, sir.
Okay, thank you very much, Prof. Thank you very much, everyone, distinguished personnel here. For us as students of University of Port Harcourt and specifically ACE-PUTO, the award given to Professor Faith is not, it will not just go without us coming in to also bring in our own thoughts. And so to our Professor Faith, we are celebrating excellence in nursing education. And on behalf of all the postgraduate nursing students in University of Port Harcourt, ACE-PUTO, it is my great honor and joy to stand here to celebrate our esteemed Professor Faith. This award of excellence is not just a recognition of your outstanding contribution to postgraduate nursing education, but also a reflection of your tireless dedication, your vision, and your passion for building the next generation of nurse leaders. Professor Faith, you have been more than a coordinator to us. You have been a mentor, you've been a guide and an inspiration. You push us to think critically, to aim higher, and to see nursing not just as a profession, but as a calling. And we, your students, are proud to be associated with you. This honor today belongs to you, but it also lights a path for us to follow in excellence, service, and leadership. Once again, congratulations, Professor Faith. We celebrate you and we look forward to walking in the trail of excellence you have set before us. Thank you and God bless you. My name is Carlo Obasi and I'm the class rep, MSc Public Health Nursing, G 2024 students. Thank you very much, Professor Best. Over to you, sir.
Thank you very much.
Carl. Thank you.
Thank you very much. Professor Faith needs to be celebrated on a daily basis. Let me put it that way. It's not easy to be an inventor and to have a patent to show. It's just that she has not commercialized it enough. I've been begging her to give me that opportunity. I will just name that chair the Hebrew Women's Chair. Hebrew Women's Chair, and I'm sure that will just blow it, as the Gen Zs
will like to. We will talk on it, Professor Best. That would be like fine to partner with you on that.
Yes, thank you very much. So we'll just we'll take a short break, and after that we'll come back for the panel discussion, and we'll be coming back by 12:35. Let's take approximately a 10-minute break, 10 minutes break, and then we'll come back for the panel discussions. And I'm sure that our panelists, distinguished panelists, they are already on call and they are getting ready for that interaction. Thank you very much. So please, let's enjoy some cultural displays from the tribes of River State. Please.
Oh,
Welcome back. Welcome back. This is 12:35 p.m. So I think we can start the panel discussion. Let's be sure that we have the panelists around. The first on the list, Dr. Blessing Tochukwu Onyije. Is she around? Hello, ma. Okay, she is. Thank you very much. Dr. Onyije, can you just say something? Let's be sure that we can hear you. Okay, Blessing. So we also have Deborah Onisele. Hello, ma. Hello, Dr. Deborah. Okay. Dr. Tabitha Leslie. Is she around?
Can they keep their video open so that we can see?
Okay, so once they indicate that they're around,
Yes.
we'll
Yeah.
recognize them. Mrs. Blessing Onyemachi Onyeje, I'm sure she's around because she's the one that helped us in sharing the video. Hello, ma. Okay, I'm sure she's around.
I'm around.
Okay.
Good afternoon, everybody.
Thank you.
Good afternoon, Prof.
Thank you very much, ma. Kano Obasi, I'm sure he's also around. Hello, Kano. Hello, Kano. Hello,
yes,
are you there?
Prof.
Okay,
yes,
that is fine.
Here.
And then Vera and Sigwe. Hello, Vera. Vera and Sigwe, is she around? Hello, is Vera around? Vera, I'm sure you'll be able to unmute yourself today.
Okay. Very much.
Okay, that is fine. Unlike
Good
the other
afternoon,
day.
Prof. Yes.
Yeah, you are partial. Oh, yeah, is it your network that is partial? The other time...
No, they muted me. The host muted me.
Okay.
So I was just praying that I won't have some challenge today.
No
okay.
problem.
Okay, thank you very much. So as we also call upon the elders in the profession, our chairperson, Professor Edet, and then our coordinator, Professor Diogo. We'll also call upon them to make their comments. And of course, the keynote speaker, we'll also call upon him to make one or two comments. Usually we'll start with the opening remarks from the panelists. And then, so we can go with, we can start with Blessing Onyemachi Osigwe. Madam, can you give us your opening remark?
Okay, Prof. Good afternoon, everybody.
Share video.
Okay,
yes.
let me do that.
Yes. Is she sharing so that we'll highlight her?
Yes.
Okay. Yes. So
I
that
am
is
now.
Yeah.
Okay. Yeah, that is fine. That is fine. Yeah.
Okay. Let me stand on already established protocols and welcome everyone here present. It's been a very interesting session, particularly today that has been dedicated to the nurses. I'm particularly excited and delighted because of the theme, being a mental health nurse myself by training. So at least some visibility and some spotlighting. I'm very happy to be a part of the panelists today or discussants today. And I really don't know what's expected of me, but nurses are always ready.
It's all right. Yeah, it's all right. That is okay. Thank you very much, ma'am, for that. So we can go to Carlo Bassi. Yeah, opening remarks. Thank you, but we'll come back to you. Let's get the remarks of Carlo. Yes. Yeah, Carlo.
Okay. Good afternoon, everyone. Also standing on the already established protocol, my name is Carlo Mwankwo Obasi. Currently, I'm the class rep for MSc Public Health Nursing. This event today, to me, is actually an honor to be part of the panelists. And the idea is that we are going to learn and we are going to share knowledge. And of course, we know how to bring it down to our community as public health nurses, how we can actually advance mental health. Thank you very much, and back to you, sir.
Thank you very much. So we can go to Nurse Vera Nsigwe. Hello, ma. I understand that Dr. Deborah is around, but let's have the opening remark of Vera Nsigwe. Hello, ma.
All right. Prof, thank you very much, and good afternoon, everyone. All protocol duly established, observed. And I'm so happy and delighted for part of this program, which is historic. And I'm delighted that I'm also part of the panel discussant. Based on the experience I've had for the past decades where I do work, so I'm truly looking for where you can really share your knowledge practical, because in all of these things put together, how do we escalate it to be more meaningful? So I'm happy to be part of it, and thank you very much for the opportunity given to me, sir.
Thank you very much. So we can go to Dr. Deborah Onisere. Hello, ma. Welcome, ma. Can you give us your opening remark? Hello? Please ensure that she can unmute. Hello, ma.
Hello, sir.
Okay, that's fine. That's fine. Madam, can you give your opening remark?
Okay, good morning, everyone. Good morning, good afternoon, everyone. This is Dr. Deborah Onishile, and I'm glad to be part of the panelists of this program. I've been following through since the beginning, and it's been very interesting and very insightful. I also want to say congratulations to Professor Faith on this award. And by way of introduction, I'm a mental health nurse. I'm also a clinical psychologist, and for fully into mental health, women and child. However, I'm glad to be part of this panelist, and I wish us a very successful interactive section. Thank you very much.
Thank you very much, Dr. Onisele. I hope I got that pronunciation right. Now we'll go around the team for their the question and answer section will now start in no particular order. But let me start with Nurse Vera Nsigwe. She currently works with the National Assembly. She currently works with the National Assembly. Perhaps she can tell us what her responsibilities are as a nurse working in the National Assembly. I'm sure that she's not one of the assembly members, so we shouldn't think that she has all the allowances and all the money we hear as senators and House of Rep members are paid. Hello, Nelson Sigwe.
All right. Thank you very much, Prof, once again, and thank you everyone for this opportunity. Yes, I actually work in the National Assembly, as Prof rightly said. So what we do, if you look at the act of the National Assembly, if you look at the Constitution, they actually said there should be Section 4, there should be a National Assembly, that all the institution, the representative in all of this should be part of the legislative arm. And for the lawmaker to actually carry out their services effectively, there should be a bureaucrat, which are civil servants, and that's how I was being employed. And our function is to care for the staff and their dependents. So basically, we care for the staff and the dependent, and we have structures how it works. You know, the elected lawmaker comes and go, but it is the bureaucrats that make the institution, you know, on grounds. Whenever the lawmaker, the people elected the lawmaker to come, we are the one receiving them, guiding them through the process of lawmaking, and that's how the laws are being used. So that's the function we do as a nurse in the healthcare service delivery at the National Assembly. Thank you so much. I don't know if
are there specific ones you carry out as a public health nurse?
Yes.
Especially the preventive aspect.
Exactly, we do that. I recall when we actually came, I've been able to spend 2 decades in the National Assembly now. What we do, initially, they just have medical services. But over the years, I remember when we came, there were so many structural issues. So I went back to school to go and do public health nursing. Immediately I came in. So I went to, after confirmation, I went to study public health nursing as in HND. So it's after that training, I got to understand that there is a lot you can do in regards to public health. So we started that conversation 7-8 years down the line. The Department of Public Health was created. And as we speak, we only have one department as at the time we came, 2005. But today we have about 9 departments under the Health Service Directorate, and we now have a PAMSEC that oversee all of these things. So regard to public health issues, within the National Assembly, we do that. Thank you very much, sir.
Okay, thank you very much. And I'm sure that when people faint at the National Assembly, people also respond.
Yes, we do that, sir.
Yes, and I'm sure there will be some eye check in case those big numbers, we hear them call. Thank you very much. Okay, I'm just, I know that you have been very actively helping out in legislations.
Yes, sir.
And from what we are discussing here, there might be some policy and legislative changes to progress nursing education and practice in Nigeria. What steps do you think should be taken to ensure that such changes are made?
All right, thank you so much for this great question, sir. Yes, like I said, the specific role we are made to do is to care for the staff and their dependent. And you have the different structure, the Senate and the House, where the committee level, you actually do those lawmaking. We were not directly involved because we are limited to carry out health services. But the question I keep on asking myself, how can a healthcare professional, you are the corridor of power where those laws are being made and you are not part of it? What do we do differently? So that's why we started making a conversation that even the healthcare professional should take up a program on legislative process. How you do that? That was why I first of all had my master's in legislative studies. What do we do? At the committee level, in fact, if you look at the mental health act that was just presented, I knew how I was fully involved in all of those activities in 2020 to 2022 were eventually passed. So it was 1958, you know, it's obsolete, and that's how it's been passed, that 2022. We follow through it. We make ourselves known to them because this process, the people that are doing it, they are not healthcare professionals. They are not but that's the area they train them to. We influence some of those things. And I agree with me also, with the healthcare professional, we don't really do much. We actually leave it for the lawmaker, whatever they do, whatever they come up with, they do it. No, it doesn't work that way. We need to be fully involved. Where you can influence, you do that. Because one of the strategy I used, whatever you do here, that's what your parents could see in the village. And that's what we are seeing. You come to the clinic, you say there is no paracetamol. It's what you do in the table that give results to that. So you make all the laws for the entire country. Can't we just do it right? And I also want to plead, sir, for this opportunity. Yes, the School of Postgraduate Public Health in the AC Puto. Can we partner with the institution itself? Evidence-based, you see laws are being passed. You don't have evidence to back it up. Those that are available, they just do that. And you know the functions of the lawmaker. They come 4 years, they go, they want to quickly pass law. What have you done? They don't care how it affects or not. So if all of us are involved, it will be fully, passed. I know it's possible. And I also want to make an appeal, sorry, the nurses, like we presented, over 50% workforce in the health sector. If nurses didn't get it right, you can't get it right in the health sector. We only so much focus in our hospital-based, curative, the academy. We need to come out, work together as one entity and follow through. It's possible, it's achievable. We have done it. We have so many evidence that we have done that, sir.
I think we are happy that we'll have you in the National Assembly. So whenever there is a committee, public hearing, please do well to inform the associations.
We do.
I know you have been doing that. Because I actually had the first time I heard of you was from Professor Asusu, when you assisted in during the Health Act and
the National Health Act 2014. So many bills, even this public health.
So please, whenever such legislations are being considered, please inform the association, the nursing association and the subspecialty associations. Thank you very much. So now we may come back to you, but let's move on to Dr. Deborah Onisele and Mrs. Blessing Oyemachi Osigbe. I think they are lecturers. They are lecturers in the School of Nursing and in the nursing program of their various universities. Incidentally, they are both mental health nurses. Can I just ask each of them? I just want to ask each of them how well mental health is being taught to undergraduate nursing students. Because from what I heard, the interest may not be there. I'm sure that is because of some misconceptions. The idea we have about madmen, you think that they are very violent persons, but we know that it's not all the mental. It's not. Should I say madness? It's not all the mental health problem we have. Hello, madam. Dr. Deborah, do you have a specific courses on mental health taught to nursing students? Sorry, I'm asking from an outsider point of view. Okay. Yes.
Good afternoon once again, sir.
Yes.
Can we see Deborah?
Mental. In fact, 4 levels. For instance, at the 200 level, we start with the introductory course, which serves as a foundational aspect, which is the developmental psychology, where nursing students are being intimated on the need to understand the basis of human development and growth.
Yeah.
And the importance of this, the profession. That's at the 200 level. At the 300 level, we have the human behavior in illness and health. I think in most schools, it's a 2-unit course that we also use. Nursing students get to understand this in preparation for when they get into the profession, where they're able to understand all of this. And this serves as the basis for the main course that it prepares them ahead of the main mental health course, which begins for some school, 300 level second semester, they start the mental health 1. We have it in 3 phases, mental health 1, 2, 3. The first mental health 1 for some schools, 300 level second semester, but basically at 400 level first semester, second semester, then we have the advanced mental health course that is being taught at the 500 level.
Okay.
And all of this is just so that they get to understand, they know what mental health is, understand why and how people behave the way they behave, understand the difference between mental health and illness. However, about the fact that students may not be interested, the fact that you mentioned that students may not be interested in mental health, them being the fact that relating it to the aggressiveness from patients. It's on the contrary, mostly with what I see with students. Students get to, because most often what I notice with students at the level starting from 200 level is they are interested in knowing their own, understanding themselves, understanding their personality. And so mental health gives that, ambience where students get to understand themselves even before they understand their patients. And so the course is across all of this level, the curriculum is so enriched such that students get to know this, understand themselves, and not just themselves, understand their patients and know how to deal with them. However, at the undergraduate level, basically, or at any level, for those that are not specializing into it fully, they still get to know what mental health is all about, so that in case their patient has comorbid, as in when the patient that they are dealing with, in a particular aspect is, also featuring symptoms of mental illness, they can identify it and know when to refer.
Thank you
very much.
Incidentally, mental health is considered as essential health care, which means it should be available even at the primary health care level. And then I hope and at the primary health care level, the nurse is likely to be the provider. I hope that is being emphasized, because at the primary care level, they are the ones providing mental health services.
Yes, sir. As it stands now, I know in few states, I don't know across all the states in Nigeria, but then basically, like for instance, let me use Ogun State as a case study. The neuropsychiatry hospital in Ogun State has gotten down to the grassroots level, where mental health services is being made available at the PHCs, and it is the nurses that attend to patients at that level. However, yes, sir.
Go on, ma.
Okay, so however, that's with respect to bringing down the tertiary down to the grassroots. However, it's not so. It has not gone so across board with almost all the PSCs in Nigeria. But then effort is being made to ensure that this goes round in Nigeria with the PSCs. But then that is why one of the bases for every undergraduate nurse in Nigeria, they must go through the mental health posting and go through this curriculum, so that they come across a case like this, at least at the very, at the preventive level, they are able to attend to patients before they refer for major treatment.
Yeah, thank you very much. I just pray that it will be widely adopted, because even in medical school, they are beginning to have what they call the community-oriented medical education. Because the cases you see at the tertiary hospitals are different from what you see in
community.
yes, in the communities. So they will need to get to know, because, for example, in Nigeria, we most of us will have mental health problems because of the economic situation, and the youths are getting into drug abuse and all sorts of things just to cope. Mrs. Blessing Oyamachi, do you have anything to add to that before we move on to other subjects?
Okay, yes, Prof, I do. Thank you very much for this opportunity. Just to add to what Dr. Deborah Onishile has said, there's a lot of misconception with students developing interest in psychiatry. I use myself as an example. After first degree, and I decided to major in psychiatry, the first person I shared that information with was my mother, who kicked against it and said, no, these people turn out to become mad. They turn out to become their patients. With very good examples of, mental health nurses around that are suspected to begin to have some psychotic symptoms.
Yeah.
While that is still left to be verified, our students still share some of these sentiments. But like she said too, the interesting part is when they begin to understand that studying mental health nursing is not just about you becoming a nurse to nurse somebody who is mentally ill, it's about understanding yourself. It's about understanding your temperament, your personality, your ability to deal with daily life stressors, which is the World Health Organization's definition of mental health. Your ability to manage stress, your ability to work productively, your ability to contribute meaningfully to the society that you belong. That's what mental health is about. So you see their interest begin to, sorry, do I go on?
No, go on, ma.
Okay, Prof. Their interest begin to peak when they see that mental health is in fact total health. And then when they are sent at their 300 level second semester to the psychiatric wards, they don't want to come back. I get calls personally every time. Oh, man, what you said. Oh, this. I saw that. You see, they are seeing relatable experiences. It'll shock you to know that even in class, they begin to diagnose themselves.
Yeah.
They begin to diagnose themselves and say, oh, you are like this. Oh, you have this tendency to be like this. So the interest begins to peak, like I said. And what are some of the challenges? Some of the challenges we face is still that stigmatization and lack of awareness. But in the academics, we're doing our best. Also, what you said about mental health being tackled in the community, you see the focus of mental health right now is shifting from institution-based to a community-based setting. Because you need to identify the people in your home, in your neighborhood. And that's why in 400 level second semester, we introduce the community mental health nursing. Simply put, what is the role of the mental health nurse in the community? In this case, your patient is no longer an individual. Your patient is the patient, the family, and the community at large. And then you begin to talk about how you can tackle community-wide crisis, cases of war, and even natural disasters that can lead to crisis. So mental health is an all-encompassing area of nursing. Very interesting area of nursing.
I'm sure that they are also being taught about skills to cope with the stress, because I think mostly it is the stress that push a lot of persons into having mental problems. Like
and into using drugs and substances just to run away from all of those stress. Yes.
Like at times they will even talk about of course the counseling section. Counseling, although that is being taken over by the churches, but in other places they teach something like thoughtfulness,
mindfulness and relaxation techniques. Yes,
that
we teach mindfulness, relaxation techniques, diversional therapy, how to say no, how to step aside from something, how to know your strengths and your weaknesses, which we call self-awareness. In fact, that is the bedrock of mental health. You should be able to know what your limits are, what you can and cannot do, given the opportunities before you. But then we preach these things, but in academics, we don't really practice it because we go way and above and beyond doing the things that we are not even expected to do in academics. But that's the story for another day.
Well, anyway, that that will lead me into what I actually want to pen down. It has to do with the teaching of nursing skills to the undergraduates. I know that in the School of Nursing, they emphasize those practical skills. But the Nursing and Midwifery Council, in its wisdom, has moved the nursing training into the universities. How are you people managing to ensure that the nurses, they graduate with the relevant skills? Because at the end, nursing is a profession. It's not like botany, where if you have the theory, that's enough. But nursing, nursing is a profession, and the quality of the education boils down to the quality of the skills possessed by the graduates. Well, are there ways you people have are there things? How do you teach nursing skills to these undergraduate nursing students?
Okay, Prof. Can I respond to that?
Yeah, please.
Okay, so I see that people widely propagate this rumor or this untrue statement that nurses trained in the schools and I bet colleges of nursing are more skillful than the nurses trained in the university. That in itself is not entirely factual.
Okay, it's not entirely.
First of all, yes, it's not entirely factual. First of all, our students have 5 days a week to go to school. In that 5 days, they take out a whole day for their clinical experience. In addition to that, it will interest you to know that nursing students are not entitled to their full holidays. So if a student has 4 weeks for holiday, they probably will just take 1 week to go refresh and spend time with their families, come back to the clinical area for a full-time holiday clinical experiences. And just most recently, the Nursing and Midwifery Council, in its wisdom, has returned the practical examinations, which we call the OSCE, that we usually do in the departments with models and They have finally now moved it to the hospital setting. So moving forward from September 2025, every practical exam will be conducted in the hospital setting. There's a memo to that effect. Yes. So that's also a way that we integrate theory and practice so that we churn out skillful nurses. Like you said, it's not like botany that you just read the books and know the theory. You need to be a hands-on skillful nurse. And we're doing our best to see that we're able to integrate theory and practice to see that our students come out with robust experience.
Good to hear. At least I now know, because at times we suspect that those. Okay. I know that you people have skills lab using where mannequins. I think it's almost like the standard feature of all nursing. Yes. So skills lab, where at least they learn with mannequins before going to the real patients. Thank you very much. And
thank you.
So the other thing too, please.
I just want to add something there.
Okay, ma.
Before we miss it, and that is the fact that, because of these complaints that the nurses are not as skilled as they should be. But it's not only nursing. I must also say that the complaint also extends to medical officers across board. So that was why the Nursing and Midwifery Council introduced a 1-year internship period to get the nurses to go through all those rotatory postings again when they are out of school, so that whatever skills they have missed, they can have opportunity to practice them. So I think if Department of Nursing, if they can adhere to the number of students that they should have, because the issues that we have now is that when you have over bloated classes, and then even the number of students that you are sending to the clinical area far exceed the capacity of
The
the
hospital.
of the hospital. So people, the students cannot really have the desired experience that they are supposed to. So there are many factors apart from the exposure, but we make all the effort to make sure that their clinical skills become sharp, at least at the end of that internship. So I just want to key in that.
Okay, thank you very much, for that contribution. But I also understand that the students are taught by persons that are not lecturers that are not lecturers in the university. So, which means that you have the lecturers in the university, perhaps teaching. Anyway, this is my own understanding. Let me.
Yes, we call them preceptors. We have preceptors in the clinical area because the ideally the lecturers in the university should go along with them.
Yeah.
For our master's students, usually maybe the first time they are going in, to break them in, I could go with the public health nurses to the clinical site. Even the midwifery students, our lecturers also go to break them in. But we don't stay with them all through. So during that period we are not there, we now have people that are preceptors within those clinical facilities that are to teach them all the time that they are there. Maybe what we need to really study is to find out whether they are picking up relevant skills from preceptors.
Yes. Well, I understand. Why not use the model used in the medical school, where the lecturers are appointed in the teaching hospital, so that they can do both jobs?
Okay, you know that Ibadan, University of Ibadan, they were able to establish that during the tenure of one of the CMDs. But it was fought against by the medical profession.
Okay, yes.
They are not consultants, they are the only ones that should.
I know.
So later on, although they kept them, but I think they changed the name. So to now have, if that one had worked, probably it would have spread over now. But we are trying within the nursing profession to structure out this consultancy thing. That because you see, you cannot just if you don't have offices, the consultant, at least you have a place, and then you'll be recognized within that structure. That okay, you are coming in to do this and so on. So whatever we do now, because some of us we still go with our students and so on, it is not formal, it's not formalized. So I think it's one of the key areas that the nurse leaders have to work on going forward.
Okay, because I was wondering why it's not so. And at times is this the word once the word and the politics start follow. Thank you very much, ma, for that those inputs. I don't know if Dr. Onisele has any addition to make before we move on to the other subjects. Hello, madam.
Yes, I just want to add to it with respect to the skills and comparison with the School of Nursing and university students. Now, there's one thing that brings all nursing students in Nigeria together, which is the council exam. And so to buttress this council exam, there's this objective standard that that every school of nursing, which the university also imbibe together, which is the in-house training in-house exam for students across board. in-house training for students across, but such that uses OSCE to train to examine to assess students in between, most especially from one level to the other. We do this as examining in-house examination, hospital-based exam to assess students and evaluate them before they go to the next level, and also the OSCE exams. And so this is not just done in isolation. Every school imbibes this. And however, how do we do this objectively? We bring in assessors from different schools to assess. So the same, so assessors from School of Nursing also assess those in the university. The ones in the university assess the ones in nursing, bringing everybody at level ground. So with this, there's no way a School of Nursing student has a skill that seems to be sharper, because what a School of Nursing student must know to pass and get the certificate as a registered nurse is also that which the the university student School of Nursing must also know, bringing everybody on the same table. So once you have the license as an RN, at least at an average level, everything that an undergraduate school of a student nurse should know is put across board. So this way, there's no disparity from with students in the university and students in the School of Nursing. However, every student still needs to work and sharpen their own skill on their own, because everything will not be taught within the four walls of the classroom. Thank you very much.
Thank you very much. But out of curiosity, how do you compare? How is the comparison between the performance of those that were trained in the School of Nursing and those that were trained in the universities? I'm sure that they both write the same
council exam.
Council exams.
Yes, sir.
What do you think?
Now, so far, the comparison so far, because after the H exam, council brings out the what's it called, percentage.
They passed, yes.
Yes, the percentage to say you hear schools saying they have 100%, some saying they have 70%, some saying they have 90%. But so far, from what I've been seeing, no, I don't want to speak with sentiment or anything. I feel that so far it has not been university based, no, School of Nursing based with respect to pass marks so far. It has, in the past, it has, from what I can measure and say, it has been as much as schools are able to prepare their students ahead of
their students.
Exams.
So there is no statistically significant difference between the performance of students in the School of Nursing and those in the universities.
There's no disparity. In fact, when we talk about statistical difference, it is now with respect to whether OAU to UI to, in fact, it's the difference between School of Nursing and the university base. The difference is not, there's no gap.
Yeah, anyway, I'm even tempted to think that those in the university will do better, because I'm sure that because the cutoff mark in nursing program very high, very high. I think it's even getting higher than that of pharmacy. So the quality of students being admitted in nursing programs has improved. Has improved.
Yes.
So I'm sure, and those going into those schools of
nursing,
School of Nursing, probably they couldn't pass the. Let me not say they could. I suspect that they had problems.
They can't make this jam. That's why they have to still settle for School of Nursing.
So
actually, it's the same. It's the same entrance level across board. Whether it's College of Nursing, whether it's Department of Nursing, the same 5 credits that we now use across board. And nursing is highly subscribed, so we are not even in short. We are not in short supply of applicants. For instance, at the University of Calabar, they've been competing with law and medicine, and there was a time that nursing was even the first well subscribed. Usually, you have over 3,000 students applying, and we have just a quota of 150. So it's usually a problem to be able to.
I know.
To pick them. So in terms of the performance at the end, that's looking at the competencies between the School of Nursing College of Nursing and the university. I think we are yet to do a proper study on it, so we can only assume. But in the UK, where it has been studied, the baccalaureate students, they perform better than those from the schools of nursing. That is what they have found in the studies that they have done. Thank you.
Okay. Thank you, Ma. Thank you for such a wonderful decision. So let me go to Kano Obasi. Hello, Kano.
Yes, Prof, I can hear you.
Okay, so let me just start by saying I'm sure that you are currently employed.
Yes, Prof.
Where do you work?
Okay, so I work as an occupational health nurse in an energy sector.
Yeah, that is good. That is good. In fact, they are very good, and they man the FLBs, this logistic base. Yes, they man it, and they are very good. In fact, one of them, I went to do a study. One of them saw me and guessed my age, although it was 10 years older than my actual age, and that told me that I had to start doing something. So they're very good. So so right now, you are in the public health nursing program. What do you intend to do with that degree after graduation?
Okay, so thank you very much. What I intend to do with this degree, MSc Public Health Nursing, after studying MSc, it is known that you become a supervisor, and what that means is that you're going into research, because there are a lot of problems that have been identified, and some of them have not been given the proper solution, and some of these problems too, they've not been well documented. So after this postgraduate program in public health nursing, I intend to go further into researching. I also intend to explore any
PhD.
available.
I know.
I intend to explore any available opportunity, study further, and also share my knowledge. Because as a public health officer, we work closely with the community. The community is not just the people in our society, but the people where we work, where we live, in our church, just to ensure that we are bringing health care closer to the door of those people. So I intend to go forward, do my PhD, and ensure that everybody within me, they are living at their best level of health. So that is what I intend to do, Prof.
Okay. Why didn't you do a master's in occupational health?
Okay, master's in occupational health is also
or you didn't want to pursue that line of career?
It's not that I do not want to pursue that line of career, because for me as an occupational health nurse, I've spent, I think, about 7 to 8 years as an occupational health nurse, but I've not actually seen where in Nigeria where I can do MSc in occupational health nurse. But I understand that University of Port Harcourt, they offer MSc in occupational health. And based on the fact that I still want to toe the line of nursing, and so that is why I am doing MSc Public Health Nursing. But for MSc in occupational health, I will still do it.
Okay, I'm sure that Double has had MSc occupational nursing, because to tell you the truth, they have a lot of, they are the cornerstone of occupational health services, even in the IOCs, the international oil companies. And the good thing is that he didn't go to he didn't subscribe to that program. That program is probably priced in dollars. Yes, but that is fine. Okay.
To buttress, Professor Best, to buttress what Carlos said, National Midwifery Council is insisting on nursing specific That's it for to be relevant in nursing. So if you had moved to occupational health, just occupational health, you will be swinging away from nursing. So he wants to maintain the track in nursing specific program. Yes, that's why.
I'm sure they are learning from you, because you went into education psychology, and then you had to go
back
and
again.
redo it, redo it again. So they learned for you. But I also understand, when I went to the Nursing and Midwifery Council website, they listed occupational health nursing. Is it?
Yes, we have.
So why is that program not being mounted? Is it that it hasn't been? And to tell you the truth, from our understanding, our relationship with NUC, once you have, they just give you the accreditation to run master's program, and then you are free to mount the various programs. So, Professor Diogo, I will commend, because I'm sure that you have a lot of persons. The oil companies are there, and not to talk of the fact. I think that is probably will bring me to these other aspects of job opportunities for holders of postgraduate nursing degrees, entrepreneurship, and perhaps I can hear from the elders. I have heard of those they call nurse practitioners. I don't know. Are there nurse practitioners in Nigeria? And if there are not, we don't have any, why? Why is preventing? Why is it that we don't have those that identify themselves as nurse practitioners, who are basically stand-alone professionals, doing their own work, running their own businesses like maternities, nursing homes, and in the case of Kano, you can even start an occupational health service. Why is it that it has not that aspect of nursing practice has not been emphasized in Nigeria? Professor Edet, Professor Diogo, I don't know if,
Yeah, and let me start with this before I hand over to my senior colleague. Nurse practitioner is, to us, is new, but outside this country, it is not new. In the US, we have nurse practitioner, and they are very independent. They can own a facility and manage it. Yes, it's there. But in our own country, we are still growing. Although council is also thinking in line of all of these grades of practitioners. But at the moment, what we have in our own system is will be a nurse, be a midwife, what we call double quali and all that. But they also have the liberty, once you are a licensed nurse, to open your maternity home, care home, and all of that. But they're not called as nurse practitioner, as it is called outside. And we are still going, even in the midwifery, we have grades of midwives. We have a consultant midwife, we have a supervisor midwife, we have the regular, midwifery practitioner. So we are yet to get there. It is one step to the other. So we are aware that such a nomenclature and their role and their domain, but we are getting there. We won't take everything at once to us. So those ones that are doing that, they started from somewhere to where they are now. So we are aware that it's nurse practitioner, position where you can own your facility, even hospital, as a nurse practitioner outside the country. Yes. Yes.
No, that's why I'm somehow surprised that you have that your chair and it's lying idle somewhere. Why not? Are you afraid?
No, I'm not afraid. I'm seeking for investors. It's a lot of money to commercialize
What I mean is this: to build a reputation using
Yes.
that chair.
Yes.
Yes, using that chair so that you sell it, you market it. I don't know if Nursing and Midwifery Council permits such should I use the word advertisement? Because I want to say I'm just trying to work it out. If you want a certain bat, I'm just looking at it. Give forth a child. She's sitting on a throne like batting chair. That I'm just looking at that.
I have done exhibition. No, nothing. Council have nothing against advertising their invention. In fact, they are very happy that a nurse could be an inventor. Because when I went to receive that patent certificate from the minister, all the other people that came to receive a certificate of invention, they were all from engineering. It went so loud when they called this one is a nurse inventor. You understand? Because they think that only people that can invent, things, innovations, and all come from the engineering side. But so I went into engineering and brought out that. But what is holding it is not that I am not allowed to advertise it. I have gone to some regional countries to do exhibition of the chair. But what is holding is the commercialization, and it requires money. So my own is to tell the whole world that I have this. I'm looking for investor.
Double. I am thinking of not to commercialize it, but to build up a reputation using that chair.
Yes.
So that I don't know. And you with social media and a lot of things, I'm envisaging.
If it is said out like that, it will be market ready. Because when I did invention, that was having many mails and calls wanting to take the chair, and it's not there. So you can't go
because I'm looking at a possibility of probably a husband desiring that the child, probably the first child, is brought into this world with the wife sitting.
It is
throne. You will just design it like a throne, and and also I'm looking at that.
Professor Best, I am just asking you to can collaborate with me, and let's see how we can bring it out and make a throne of it. Yes.
The good thing is that our university is an entrepreneurial university, so we look at how to make money out of our inventions. Professor Det, you want to add one or two things?
Yes, I know, advanced nurse practice is what we call it, and it's been in existence for over 20 years in other climes, particularly, starting from the US, UK, Australia, and then later on UK. So you have them as either nurse practitioners and also or clinical specialists. But there are some things that has to be put in place before we can have them properly established in Nigeria. So the good news is that Nursing Council has bought into it, and they have decided that they are collaborating with some universities outside, and they are going to roll it out. I'm sure in the next year, that's 2026, this country would have rolled out, and then they will have a register for nurse practitioners. Right now, we have some that have trained as nurse practitioners in other countries and are right in the country, but they cannot start practicing until it is fully approved here, and they register for it, and they are registered and they are licensed to practice. But Nursing Council has done a lot in terms of the legislature, because this category of people, from what we have heard, they will be able to prescribe. They can admit patients on their own. They can treat. They can do virtually a whole lot. It's an expanded role. that is beyond the curriculum that we are running now. Because what we are running in the universities now is basically academic masters. But this one is going to be not just academic, but professional. And there's a period of residency, just like the doctors have residency. We are saying that they'll have a residency period of like 2 years, and then they will be so licensed, and then they will be recognized in Nigeria. That's nationally by the country. Because we know what is going to happen, because they are going to be performing some roles that are outside the current nursing role. So they must have proper legal backing, so that when we come out, yes, although we know there may still be a little conflict there and there, but once we have our good legal backing and it's recognized by Nigeria as a country, then it can flourish. We have been eyeing it for several years. In fact, we have been for several years, but it's just to put it on a very good footing. So I'm sure by 2026 it should be out there. We crave for the support of other professionals within the healthcare system, that they will support us. They will promote the program, because there's a level playing field for everybody. So
thank you, ma. But other opportunities are cropping up. We have an aging population in need of care. So and care centers. Care centers or nursing homes are becoming very. In fact, they used to say that a lot of the nurses that go abroad actually are employed in those care homes. Are we looking at it? Because the demand is there.
Yes, we are looking at that as well.
My mom, before she passed on, needed such a care, and it was difficult. She had 8 children, but still we found it difficult to take care of her when she was alive. So care homes is another opportunity, another opportunity that nurses in Nigeria can.
That will require a lot of money. But in terms of educational background and competencies for it, gerontological nursing is one of the areas that we roll out. Because even midwifery, midwifery in the US is an advanced nurse. It comes under advanced nursing practice. It's not what we call it here. Here it's a certificate, but it is not. Now that we are calling it, it's under HND. At least we have been able to quantify. But climbs. It's a master's program, and that's what we intend to do in the future. That even the midwifery program, the occupational health, all of that, they will be under that advanced nursing practice with a master's qualification, rather than, because one of the things that has really not helped us as nurses is most of the skills and the education we are rolling out, we roll them out under diploma or even certificate. So Nigeria is a place where they value education.
They value.
You say you have a certificate. I mean, nobody is going to give you an expanded role.
Yes, so. Yes, thank you very much.
Have masters in the area, yes, they know that, okay, you have additional skills. And
it's good we look at the naming or the nomenclature of our qualifications. I remember as a doctor, they used to tell us that after all we have a diploma, a fellowship.
Yes, that's the latest one I saw recently. They said that the fellowship is a diploma.
They say it's a diploma. Okay. Thank you very much, ma. Anyway, that is where the emphasis is on the skill, on the skill of on the skill and not. Hello.
Prof, I don't know whether I can have a party word. They are calling me to address some issues.
No.
In the
Okay,
office.
please do.
Yes.
Please do.
Thank you
Because I
very
wanted to
much.
even do yes. Please, can you just do that so that
Exactly.
to enable me take about the vote. I wanted to even say the vote of thanks, but you can go ahead.
Sorry.
Can you?
Prof, thank you very much. And thank you, my professors and everyone. Please, Prof, I want to make a passionate appeal. Now, this program we have put together with your team for the past 2 weeks, at the end of the day, what happened? Can we partner with this institution, evidence-based, with all the students, the research has been done? It's possible. It's just to advocate, and you will see it comes to pass. Partner with the National Assembly, have evidence-based to develop policies and programs. Look at the various ideas. It is the disconnection that led to some of those problems that I discovered. So if we all work together, I think our health system in Nigeria will be much better. Thank you.
Thank you very much. So on that note, we may not have the opportunity to give others that that opportunity. Thank you very much. Let me just say vote of thanks before we take. I don't know if the chairperson will want a closing remark, or I can go ahead and give my vote of thanks. Hello, ma.
Hello. Okay. Just a wrap up of our experience today. I think our experience today has been remarkable. We started with the welcome addresses, and I would like to join my voice with that of Professor Faith Diogu to thank the university for giving nursing a special day, at least to have a voice, because that is one of the things that we always want to have a voice to showcase what we have been doing, and to showcase also what should be the frontiers for nursing for the future. So a few things, we have learned a few things. We have learned that public health nursing should not be viewed on its own, but rather it should be viewed in conjunction with mental health and mental health nursing. And that if we don't have a good mental health, then we cannot achieve the universal health coverage that or well-being for all our people that we hope to achieve in just how many years to come, in 5 years to come, by 2030, because we are in 2025. By 2030, we should have achieved well-being for all our persons. So we need to focus more on mental health. And focusing on mental health will mean, as I said at the beginning, that we should use a framework like the socio-ecological model. We should focus at individual level, group, family level, and also at the community level. And we have been able to establish that the public health nurses, because mental health nurses for now are in very much short supply, and we cannot be sure that we have them at the primary health care level in our country. But the nurses, we know the nurses also are in short supply at the primary health care level. What we have at our primary health care level mostly are the CHUs and the junior and the senior CHUs, and those are the ones we have. But we still have some nurses at that level. And our nurses that finish at the university level, how many of them actually go to primary healthcare level. Even those who finish from the schools or the colleges of nursing, how many of them are found at the primary healthcare level? But what we can advocate is that wherever they are found at that level, they should know that part of the duties or function they should render should be assessing their patient or client for mental health needs and seeing how they can also meet that need. And one of the other things we have learned is that it's important that we continue to encourage our nurses to be part and parcel of politics, and which is important because you see, when decisions are taken and you have to come and implement it, it's not just enough, but you should be part of the decision making. We should be part of policy at whatever level where we find ourselves, whether it's at the state level, federal level, or local government level. Even in the institutions where we are working, we should be part of policy. Our voices should be heard. And we thank God for ASEPUTO because the voice, they are ready to listen to us. That's why they have decided to give us a day to express ourselves. And we are very, very grateful for that. I know I cannot cover everything, but the Mental Health Act is already is in place, but it needs to be implemented, because that's what we learned from the keynote speaker, that the implementation is almost zero. It needs to be implemented, and whatever roles we need to play to be able to implement this, we should go ahead. I know that ASEPUTO is supplying nurses at the postgraduate level and is advocating for a rapid implementation of nurse practitioners, advanced nurse, specialist nurse, specialist nurses, so that they can be able to, maybe apart from working with public or private health facilities, they can establish something on their own, and they will be able to promote the frontiers of the healthcare system in Nigeria. Well, I want to thank you also for giving me the opportunity to chair the session. I've learned a lot, and we have rubbed minds together a lot. So whatever we have learned as individuals and as groups or in university, we should go and put them into practice. Professor Best, please remember the formation of mental health clubs, or what do you call them, that came from the keynote address, at least.
Yeah, we will do that. We will do that.
Okay, so that students who may be having challenges,
yes, counseling, yeah.
They can be counseled. So on that note, I would like to say thank you for inviting me, and I'm very happy to have participated. And Professor Faith Diogu, congratulations, you really deserve it. Please move forward from there, and let's see what happens with the betting stool.
It's okay. Thank you too. Thank you for coming.
Thank you very much, madam. Thank you. So let me go ahead and give my vote of thanks.
Excuse me, Professor Best. Can
yes,
you just look at
Double
can
time.
you look at no,
I'm
something.
Not talking.
No, I want you to look at your WhatsApp. I have a message there for you.
Okay, so I should look. Yes. Well, you can go ahead and make your comments while I look at.
Okay. Thank you, everyone that have made the day for us. I will start thanking the coordinator or director of this School of Public Health and the organizers of the first annual conference of the School of Public Health, and for remembering to include nursing into their program. It gives us a very big heart that we are all recognized and welcome into the medical or healthcare field. it is not out of place if I continue to say we are so happy and appreciate this gesture. And I thank all the people that invited, Professor Edets, that we asked just on one call away, can you be our chairperson? And she gladly accepted. And also she has been with us for many years, training our postgraduate students in public health. She's been part and parcel of it. So it was not also out of place that she gladly welcomed that, invitation. I appreciate that. I appreciate your time, and you have kept this calendar for us. And in spite of your tight schedule, we appreciate you, ma. I appreciate our keynote speaker, Dr. Stanley. I want to say we appreciate your presentation. I personally chose this group because I'm looking for those that have what it takes to be in this conference. And as I chose the team, and I look for who can deliver the mental health lecture very well, and we found Dr. Stanley, and he didn't disappoint me. He has done justice to it. Dr. Stanley, I say thank you so much for accepting to be our keynote speaker and giving us a very wonderful and exciting lecture. We've done so well. We are keeping the nursing flag high, and that's exactly what is my intention. And I want to appeal to Professor Best, if there is any other way you can support us and help us. We want Dr. Stanley to be part of nursing department coming soon. So please, I am going to come to you personally. I am even saying it openly. If there is any venture you have to help us and get this young man down to our department, we need him. We need him. Sincerely, we need him. Just help us. I know you are very close to the Vice Chancellor. We will make that appeal on our behalf and let him help us bring down the judges to help our department, because we lack that in that part of nursing. In my department, we have only Mrs. Onyamachi, that is a master holder and PhD ongoing in psychiatric nursing. So, and if we now go into faculty, as we are planning to go, because council say we should go towards faculty, and we have been approved to become a faculty, mental health is going to be a department, and it will not be nice to have only Mrs. Onyamachi in the department. So if there's any way you can help us drag this young gentleman to our university, we will be glad. We'll be so happy with it, because we need him to expand our horizon in the department as we are going forward to become faculty. Please help us on that note, because I know you are close to the corridor of power in the University of Port Harcourt. So I know you'll be able to help us. And I thank the discussants that we carefully chose. From the class rep of public health masters, Carlo. That boy is a wonderful boy. In fact, he's corrected all of these things that come to be. He started the move, and this is not the first he's doing this kind of a thing, and he's doing more. So we thank Carlo for bringing this idea, and selling it out to the public health, the Department of AC Puto, and for Professor Best catching the vibe and adding us into this thing. Carlo is a wonderful student, and is going to be a very resourceful person in nursing community. Carlo, you are welcome. The other Dr. That's other, I don't know her name again, Dr. Deborah or what. I thank you also to be part of this, because that you did very well. Vera is our personal person, my esteemed student, and who is doing very well outside here and flying the nursing flag where she is. I appreciate you, my sister. I appreciate you, my colleague. What you are doing, we are behind you, and we are proud of you. Continue to flag nursing anywhere you are. Thank you so much. I thank Mrs. Onyemaji Osigwe. That is from my own department. She is a vibrant mental health nurse, and she even gives us the counseling you're talking about. In the department, she's actually teaching and giving us mental health awareness, both students and staff. I thank her. She is upcoming high flyer, and I'm happy to have her here as one of the discussants. Welcome, my sister. You are going to have some other people join you to move mental health department forward in the nursing department. And in a short time, you will be done with your PhD, and that will be an added advantage to the department. I thank every other person. Is there anyone I have not remembered in that panelist to thank? I thank everyone. I now thank my students that we are able to register, enroll, and participated and stayed from beginning to the end. I thank you all. Many of you were to do your proposal defense today, and it was quickly cancelled for this to hold, and you could change your schedule quickly to this. I thank you also. I am proud of every one of you. I am proud of every one of you. I thank the IT people doing this work, supporting Professor Best. They are doing a wonderful work. And we have never had it like this in University of Port Harcourt, doing a very long virtual conference. This is the first time I am seeing this. I see it outside. I enroll in such, conferences that stay long and virtual. This is the first time I'm seeing it in our country, and it's happening in our own university. This is a very big innovation that should be reckoned with. Thank you, Professor Best, with your IT team. They are so wonderful. God bless every one of us. Thank you for making a day for nursing. Thank you for including us in this conference. We appreciate more than we can speak. Thank you so much.
Thank you, Professor Faith Diogo, the recipient of the School of Public Health Special Recognition Award for service to mankind, I must add. So let's take the closing formalities. We are going to start with the nursing item, the University of Port Harcourt item, and then we'll close with the national item. Thank you very much. So let's stand for those items. Thank you. Please. The items, please.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation. Immaculate and amicable, we are the source of hope to ailing ones, and the foundation for building a healthy world. Together we shall stand. Nurses are great, nurses are caring, an epitome of humility and service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse. From near and far we have gathered with one goal, to uphold the good name of our profession, and for neatness and splendor, you for understanding, R for responsiveness, S for selfless service, I innovative and initiative, N for nobility, G for gentleness and love. Nurses are great, nurses are caring, an epitome of humility and service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse.
Thank you. The University of Port Harcourt item.
Nigeria.